I can hear you.
Okay. Hi, Angie. Thank you. Well, good morning, and it's exactly 10 o'clock. I just want to welcome all of us to this event in honor of our dear school mental health expert. And um, I think we'll just go right ahead and start. And I'll just put up the agenda. I want to welcome our celebrant, Dr. Tolulope Bella-Awusah, to this virtual symposium. I want to welcome all our very special faculty members, speakers, and all CCAMH friends and family. I can see that one of our very, very distinguished elders in among the Organization of Women in Science, Professor Falusi has joined. I just want to acknowledge you, Ma. Thank you so much. And I'll go on as we proceed to acknowledge everyone. So I'll just go right ahead and share the agenda so that everyone can be carried along. Um, so I hope you can all see my screen. Yes. So once again, welcome to this virtual symposium. This is, like I said, our agenda in honor of Dr. Tolulope Bella-Awusah. But more importantly, we want to celebrate her work and our work in school mental health. So the agenda is this we're in the opening session, and I've already started giving this welcome to everyone. We're going to watch again a short, updated, pre-recorded video with messages of congratulations. And then we'll have the reading of the celebrant's citation in summary. And then we'll go right away into the alumni presentations. There'll be short presentations from each of the speakers. And then we'll have a time for discussion, interactive session. We would like to we'll take comments from other CCAM members who have done work in schools, brief comments, and other people, participants can submit their questions via the Zoom link chat. And then there will be a virtual toast, and then we'll open comments from friends and families. And then our dear celebrant will give reflections and response. And then there'll be a closing marks and a vote of thanks. So we're now going to go and listen and to this beautiful video that really expresses my opening remarks. Many people have spoken, and we'll take it from there. Thank you so much.
Sorry, ma, there's no sound to the video.
Sorry about that. I'm going to take the video again. Sorry.
Happy birthday, Dr. Bella-Awusah. 50 years. Wow. As you celebrate this huge milestone, may your life continue to shine as brightly as your wisdom and strength. Your dedication for excellence and your passion for child and adolescent mental health, especially school mental health, they have shaped so many lives, including mine. Thank you for your mentorship. So here's wishing you joy, good health, and continued success in all that you do. I wish you long life and prosperity. Happy birthday, ma.
Happy birthday, Dr. Tolulope Theresa Bella-Awusah. I really appreciate God's goodness in your life. Over the years since I've met you, you've been tremendously helpful to me, supportive. In fact, I say you have been more than supportive. So I want to say a big, wonderful birthday to you. May God your labor and to see you much more successful and prosperous.
Dear Ma, happy birthday to you on this special day. I want to use this opportunity to thank you for your motherly love and advice, for your support, for being the best boss, and most especially for always correcting me in love. I pray the good Lord bless your home and the works of your hands in Jesus' name. Thank you. God bless you, ma.
Happy birthday, Dr. Bella-Awusah. Very humble and she's very nice. So I wish you long life and prosperity. Many happy return in Jesus' name. Go from glory to glory. You celebrate this year with joy. Next year, we will no more over you in Jesus' name. I love you. I love you. I love you, ma.
Today, your leadership and excellence in the mental health field as you celebrate 50 remarkable years. You have led with humility and have inspired me and indeed all your students to walk in excellence and in faith. As you enter this new chapter, may the Lord renew your strength like the eagle, wisdom and joy. We celebrate you, ma. Happy 50th birthday, dear Dr. Bella-Awusah.
Happy 50th birthday, Dr. Tolulope Bella-Awusah. Today we celebrate more than a milestone. We celebrate the incredible person that you are. Thank you for being a mentor and role model. You have always been so easy to talk to, with a listening ear that makes every concern feel valid. And you don't just listen, you encourage, you champion my progress, and you remind me of my own strength. Your work in child and adolescent mental health is an inspiration, and it challenges me, and I'm sure many others also, to do better and reach for more. Something I also admire is your beautifully balanced outlook on life. You show us that we can pursue excellence with compassion, and ambition with grace. So thank you, Dr. Awusah, for lighting the way. And I wish you many more years, and that this year and many more be as wonderful as you are. Happy birthday, ma.
Happy Golden Jubilee, Dr. Tolulope Bella-Awusah. It is such a joy to celebrate this day with you, this beautiful, wonderful, glorious day with you. I met you almost a decade ago, actually, and knowing you, you're calm, you're gentle but firm. You're intelligent. Most of us mentees, Prof's mentee, we look up to you. When Prof is talking about you, and he say, only Dr. Tolulope knows exactly what I'm thinking or thinks exactly like me. And then she recounts the stories of the world, like almost every time. It's so beautiful to see you, to know you, to have known you these years, to have worked with you, to have learned from you. In Jesus' name, I hope you have a great fun today. Once again, happy birthday, ma. God bless you.
Dr. Bella, how person and very respectful. Please, let's see, intelligent. She's a very good leader. She has a listening ear. I don't know if she's doing anything, but she's working underneath, and she's later you will see the success of. The Lord is going to meet all your heart's desires, and you will celebrate many, many more. The Lord tarries. I know another Jubilee will come. Wish you well in everything that you do, and I pray that you enjoy this your new season in Jesus' name.
Happy Golden Jubilee birthday celebrations to our very own Dr. Tolulope Bella-Awusah. You've always been a big sister right from undergraduate days through residency, working together in the same department of psychiatry as well as within CCAMH, ever brilliant, quietly dependable, dedicated to services, kind to a fault with a humane face. This is wishing you many more happy and fulfilling years ahead. Happy 50th birthday.
Happy birthday, Dr. Bella-Awusah. This is Kwabena Kusimensa. I proudly served with Dr. Bella-Awusah as her General Secretary during the days where we served as executives of ACAM, the African Association of Child and Adolescent Mental Health. And she handed over the baton to me. I celebrate you, ma, her quiet leadership, her strength, her focus, and the determination with which she gets things done. I mean, she always text me, my case, Kwabena, have you done this? People see her quiet, but she's a powerful leader and a very determined person. Happy birthday, ma. Your lessons that I learned under your tutelage, and even as my teacher in CCAMH, and as a co-examiner now in the WACP, have carried them with me wherever that I am. And oh yes, in my capacity as the newly elected president of the Psychiatric Association of Ghana, PAG, I'm definitely going to carry forward your legacy. I wish you well. I wish you long life, prosperity, and success, and may you continue to impact more and more lives, more and more people in every sphere of influence. Happy 50th birthday, Dr. Bella-Awusah. God bless you, ma.
Happy 50th birthday to Dr. Bella-Awusah. From when we started working together 13 years ago in CCAMH, I knew you were destined for greatness as a child and adolescent psychiatrist. The recent elevation to the position of a reader is evidence that you're on the path to greatness. On this, your 50th anniversary, I wish you many happy returns.
Happy birthday, Golden Jubilee birthday, Dr. Tolulope Bella-Awusah. It's been a delight to have known you for so many years. I first got to know you as a medical student. I was very privileged to have taught you and even interviewed you. You belong to that very special MBBS class. I wouldn't say what happened, but I know your class encountered some difficulties. And I interviewed almost the entire class. And I had a glimpse into the special person you are. But then, as a resident doctor, that was when I was simply drawn to you for several reasons. And I'm going to give just 5 reasons as we celebrate your Golden Jubilee. The first reason is your passion for social justice. Social justice is a central theme in Scripture, emphasized in verses like Micah 6:8, which says, "And what does the Lord require of you? To act justly and love mercy and walk humbly with your God." And Proverbs 31, verses 8 and 9, "Speak up for those who cannot speak for themselves, for the rights of all who are destitute, the rights of the poor and needy." I really found you to be somebody that wanted justice, particularly for the weak, for the children. And this brought us together. And I'm so happy. On the very first day I went into the remand home on March 6, 2003, 22 years ago, I was a consultant, you were a junior resident. We went together. We were both affected and determined to bring change. And this led us onto so many community outreaches. SOS Village, schools in and out of Ibadan. You always came along. Number 2, as we celebrate 50 years of glorious existence on earth, great minds think alike. At ward rounds, when you were my resident, I found that every time my perspective was your perspective, and I was so blessed. Number 3, Tolulope, you're a woman of faith and royalty. When the child and adolescent mental health journey started, we had virtually nothing, but you believed and walked faithfully around. You even agreed to take on several leadership roles, even though I knew you would rather stay in the background, doing your work and supporting. Number 4, you're a builder of the vision. You were initially a co-investigator in that great proposal we put together, the award-winning proposal to be able to create the Center for Child and Adolescent Mental Health. But then I removed you as a co-investigator and I said, go and do the master's, and you did it. It was rough and tough. You endured. You had a full-time job as faculty consultant. You were even at some point you got pregnant. But you pulled through with distinction and a great project. And when I became provost, you took over the leadership of CCAMH, and you did this with excellence and humility. Number 5, you were a great and focused researcher. Right from residency, you showed you were great at research and manuscript writing, and we worked closely together. I'm so grateful. You took on the leadership of school mental health on the continent. I'm very, very grateful for all you have done and all you will yet do. And so I want to thank your parents for raising a great woman, a great princess of the Most High God. I thank your dear husband, Dr. Ikechukwu Awusah, for being a loving, a supporting, and a great man. And of course, your children. Thank you so much for coming on the journey of child and adolescent mental health with me. Your best years of glory and honor are yet ahead in Jesus' name. Happy Golden Jubilee celebration for me. Olayinka Olushola Emito. God bless you. Happy never understood.
So I hope you enjoyed listening to that. And that basically summarizes my opening remarks. Diola had said it earlier about the things I say about Dr. Bella-Awusah, about the ward rounds. And we never discussed. We're actually on different continents, but everybody remembers and everybody knows. So on that note, on our agenda, we'll just go straight ahead and we will take Dr. Awusah's summary of her citation. So, Dr. Awusah, are you going to put on your video? You want to be silently in the background while I have, so that
Thank you.
you will stand up.
Oh,
I'm only, I'm only joking. So I would put, Diola, I'm controlling things from this. I'm not a controller. We just thought that. So Diola, are you there?
Yes, ma'am.
Okay, so I'm going to put up the I don't even know which one you sent to me this morning because you didn't rename it. What's it called? Okay.
So it has to be at the end of it.
Okay. Okay, so Diola is going to read the citation. Diola, can you see my screen?
Thank you very much, ma'am. Yes, I can. Okay, thank you very much, ma'am. Good morning, everyone. I would read the citation of today's celebrants. Dr. Tolulope Theresa Bella-Awusah is one of Nigeria's foremost authorities in child and adolescent psychiatry and school mental health. She is a reader in the Department of Psychiatry at the College of Medicine, University of Ibadan, an honorary consultant child and adolescent psychiatrist to the University College Hospital, Ibadan, Nigeria. Next slide, please. Dr. Bella-Awusah obtained a Bachelor of Medicine and Bachelor of Surgery (MBBS) degree from the University of Ibadan in 1999. She completed residency training in psychiatry at the University College Hospital, Ibadan, earning the fellowship of the West African College of Physicians, FWACP, in 2007. She obtained a Master of Science degree in Child and Adolescent Mental Health with distinction from the Center for Child and Adolescent Mental Health, CCAMH, University of Ibadan in 2014, CCAMH's Pioneer Set. She has complemented her clinical and academic expertise with advanced training and research experience at prestigious global institutions, including the University of Warwick, United Kingdom, University of Pittsburgh, United States of America, and the University of Navarra, Pamplona, Spain. She is presently rounding up her doctoral work at the University of Warwick, United Kingdom. Across continental education has enriched our understanding of culturally grounded, evidence-based approaches to child and adolescent mental health and global health. Next slide, ma'am. She currently serves as head of the Department of Child and Adolescent Psychiatry, where she oversees academic programs, research development, and clinical training of future psychiatrists and mental health professionals. From 2020 to 2024, she was acting director of the Center for Child and Adolescent Mental Health, CCAMH, University of Ibadan, a center of excellence established to build capacity, drive research, and influence policy on child and adolescent mental health in sub-Saharan Africa. She currently is the Director of Academics at CCAMH. Under her direction, CCAMH has expanded its impact through interdisciplinary collaborations, training programs, and international partnerships that bridge research, policy, and practice. Dr. Bella-Awusah's research interests covered child and adolescent mental health, school mental health, and the psychosocial dimensions of health and illness. Over the years, she has demonstrated remarkable scholarly productivity, contributing to more than 60 peer-reviewed journal articles, book chapters, and technical reports, many of which have informed mental health policy and practice within and beyond Nigeria. She has served as both lead and co-author on a wide range of studies exploring early interventions, help-seeking behavior, and the integration of mental health services within schools and primary care systems. Our research portfolio also includes active participation in numerous multi-country research grants hosted at the Center for Child and Adolescent Mental Health. She is a co-investigator on the Support Comprehensive Care and Empowerment for People with Psychosocial Disabilities in Sub-Saharan Africa Succeed Project and the Supporting Healthy Living and Nutrition in School-Age Children, in School-Age Adolescents SHINE Project. She also serves as a faculty member on the Women-Derived Mathematical Models for Mental Health Wealth Program, formerly titled Utilizing Mathematical Modeling to Tackle Depression and Related Mental Health Conditions Among Adolescent Girls and Young Women in Sub-Saharan Africa. In addition, she is a doctoral student on the Transforming Access to Care for Serious Mental Disorders Transform project, also domiciled at CCAMH. Through these initiatives, Dr. Bella-Awusah contributes to advancing evidence-based research, promoting implementation science, and strengthening capacity for sustainable mental health systems across Africa. Dr. Bella-Awusah has played an invaluable role in strengthening research capacity across the continent. She has supervised and mentored numerous early career researchers, postgraduate students, and fellows, several of whom have gone on to hold academic and clinical leadership positions in mental health. Her mentorship extends beyond technical guidance to promoting curiosity, ethical scholarship, and a passion for service. Through this investment in people, she has helped to nurture a growing network of African scholars advancing research and innovation in child and adolescent mental health. Her influence extends beyond academia into continental leadership and professional advocacy. She has served on numerous national and international committees, contributing her expertise to the development of mental health services, policies, frameworks, and implementation strategies. This includes serving as scientific chair, first CCAMH conference, June 14 to 16, 2016, chair, School Mental Health Policy Guide Working Committee of the Association for Child and Adolescent Psychiatrists and Allied Professions in Nigeria, ACAPAN, from 2018 to 2019, coordinator and lead facilitator for the training of teachers in child and adolescent mental health at the Vale College, Ibadan, from 2018 to 2019. Coordinator of School Mental Health Clinics at the Ibadan International School, 2018 till date. President, African Association of Child and Adolescent Mental Health, ACAM, 2018 to 2022. Vice President, International Association for Child and Adolescent Psychiatry and Allied Profession, IACAPAP, 2018 to 2022. Editorial Board Member, International Journal of School Health, 2022 to 2024. Chair, College of Medicine, University of Ibadan Student Counseling Committee, 2021 to date. Chair, University of Ibadan Students Mental Health Committee, 2023 till date. Revision Course Coordinator, West African College of Physicians, WACP, Faculty of Psychiatry, 2020 till date. Dr. Bella-Awusah's contributions have been recognized through several awards, fellowships, and invited engagements. So I highlight a few. Travel fellowship to attend the 2005 World Psychiatry Association 13th World Congress of Psychiatry in Cairo, Egypt, 2006 Donald J. Cohen Fellowship for International Scholars, 17th World Congress of the International Association for Child and Adolescent Psychiatry and Allied Professions, IACAPAP, Melbourne, Australia. 2007 IACAPAP Study Group Scholarship Award, Nairobi, Kenya. 2010 World Psychiatry Association Mood Disorders Fellowship, Pittsburgh, USA. 2013 Helmut Remschmidt Research Seminar Travel Award, Stellenbosch, South Africa. She has practiced in international research consortia and leadership initiatives to improve mental health systems and outcomes in low and middle income countries. She continues to collaborate with global partners to develop contextualized interventions that promote resilience, well-being, and inclusion among young people. Beyond her scholarly and professional achievements, Dr. Bella-Awusah embodies the values of integrity, compassion, and service. Her work has consistently bridged the gap between research and the real-world impact, translating scientific evidence into practical strategies that improve the lives of children, families, and communities. Through her mentorship, research, and advocacy, she has become a role model for women in science, academia, and leadership. Today, we honor Dr. Tolulope Theresa Bella-Awusah and her significant contributions to advancing mental health in Africa. Her vision, scholarship, and leadership continue to inspire hope for a future where every child has access to mental health care and the support they need to thrive. Her legacy is one of excellence, empathy, and enduring impact. It is an example of how one life devoted to service can brighten the path of many others. Ladies and gentlemen, I present to you Dr. Tolulope Theresa Bella-Awusah, a leading school mental health expert, a trailblazer in child and adolescent mental health, a compassionate leader, and a shining example of excellence in service.
Congratulations, Tolulope. It's such a delight to see all the things you've accomplished. And it also reminds me that I'm getting pretty old. Okay, so it's so wonderful. We'll just go straight ahead and take the go into the symposium. And I'll continue once again to be sharing from this end. I once again want to acknowledge the presence of all our very distinguished participants, CCAMH faculty who have taken time out of their busy schedule to join this meeting. So we're going right ahead to share the slides for this very, very okay. So can you, okay, I hope you can see my slides, everyone.
Yes.
So at this meeting, at this virtual symposium, we just felt that it was important to, first of all, showcase the importance of school mental health. It's a topic that we really, really need to bring to the fore. And I hope when we'll have robust discussions at the end of this session, it's one of the only ways many children will ever be able to access mental health care, because there simply is nowhere else where they will be picked up and where they could be helped. So it is very, very important. And I'm so delighted that Tolulope had taken a lead in developing school mental health services and research. And today we have just 6 of her several mentees. She has supervised over the years several projects, research projects, both in the West African College and of Physicians and Center for Child and Adolescent Mental Health. So today we're going to be listening to Mohammed James Kuruma. I'll introduce them again. Eunice Umoren, Chuka Onoye, Dr. Ngozi Obaijemba, Feishara Taiwo, and Dr. Olubumi Fola Bolumole. So we've arranged it, and their slides will come up. So this is the various topics they're going to be speaking on. Each of them has 10 minutes, and once it's 10 minutes, I would appeal to you to round up, please. We may have to just relax and do a good presentation, but just be conscious of time. So our first speaker for today, and the title of this is Alumni Presentations, The Ripple Effect of Mentorship. Alumni Presentations, The Ripple Effect of Mentorship. We have Mohammed James Kuruma, set 2 of CCAMH. He'll be speaking on training on child mental health, on teachers' knowledge of developmental and behavioral problems in primary school children in Ibadan, Southwest Nigeria. I'll just say that, sorry. Mohammed, in CCAMH, we prefer our students to return to their home country to do research. So we've been very privileged in the Center for Child and Adolescent Mental Health, University of Ibadan, to have trained professionals from 14 African countries. And they've all gone back, whether it was Malawi, Eritrea, Somalia, Zimbabwe, Zambia, Sierra Leone, Ghana, the parts of Nigeria. We encourage them to go back home to collect data so we can build up great research from across the continent. So we have research work from Liberia, and all this, Kenya, Tanzania, all the countries that we have had students. But Mohammed James Kuruma, the time he was supposed to go home was when there was Ebola. I remember very vividly. The Ebola epidemic was on in Sierra Leone. And very sadly, I mean, of course, we all remember it was really, really tough. People couldn't travel. There were a lot of losses. So even though he's a Sierra Leonean, he had to do his research work here in Ibadan. So Mohammed James Kuruma, BSc Hons from the University of Sierra Leone. By the way, Sierra Leone is my second country. I've been Creole girl, so I'm half Salon person. So I'm half Sierra Leonean. He's a founding fellow of the Sierra Leone College of Nursing and Midwifery. He has a master's in child and adolescent mental health from the University of Ibadan, second set. He's currently a child and adolescent mental health principal nursing officer at the Oladurin Children's Hospital and the President Julius Maida Bo Pediatric Center of Excellence. He is the vice president of the International Association for Child and Adolescent Psychiatry and Allied Professions, representing Africa. He's an associate lecturer at the College of Medicine and Allied Health Sciences at the University of Sierra Leone and head of Department of Pediatric and Neonatal Nursing. He teaches pediatric nursing, mental health, psychiatry nursing, and nursing research. I'm so proud of James Kuruma Mohammed because he went back after his training and he established the first child and adolescent mental health unit in Sierra Leone. I think he deserves an applaud. And continues to provide specialized pediatric and neonatal care. I was so delighted when I visited Sierra Leone for research a couple of years ago, and I was able to visit his clinic. Well done. His research interests include child and adolescent mental health, evidence-based nursing practice, and nursing education. He's co-authored a 2025 publication in the International Journal of African Nursing Sciences and contributed 2 chapters to Fundamentals of Nursing in the Sierra Leone context. He is committed to advancing child and adolescent mental health services and nursing education in his home country, Sierra Leone. Over to you, Mr. Mohammed James Kuruma, to do your presentation. I will help you move your slides.
Thank you, Prof. Good morning, professors. Good morning, distinguished colleagues, mentors, and fellow alumni. It is an honor to be part of this special symposium celebrating Dr. Tolulope Bella-Awusah's Golden Jubilee, a remarkable milestone that reflects years of dedicated service to child and adolescent mental health in Africa and beyond. As you have heard, my name is Mohammed James Kuruma. Today, I'll be sharing insights from my study titled Effects of Training on Child Mental Health on Teachers' Knowledge of Developmental and Behavioral Problems in Primary Schools. Next slide. This study was based on the background that around 10 to 20% of children globally experience mental, developmental, and behavioral disorders. And of course, in sub-Saharan Africa also has the same problem. And of course, we all know that teachers are often the first to observe children's developmental and behavioral issues, but they lack adequate knowledge or adequate training. And of course, also there are a few intervention studies targeting teachers in low and middle income countries, including my country and West Africa as a whole. The research gap here is that there is limited evidence of the effectiveness of teacher training programs to improve knowledge and attitude. The aim of the study was actually to evaluate the effects of a child and adult training for teachers in primary schools. There were 3 main objectives. We wanted to determine the pre-existing knowledge of teachers regarding child mental health disorders, and we wanted to determine the attitude of teachers towards child mental health disorders and determine whether the training could actually improve the teacher's knowledge of school children developmental and behavioral problems compared with a control group. Next slide. Now, this was a quasi-experimental study design that was implemented in Nigeria, Ibadan, not in Southwest Nigeria. So we decided to recruit 140 teachers. Of course, Ibadan, not local government areas, were into 9 geographical areas. So we decided to look at two geographical areas that are far apart, the Emetu and the Abadina area, which are 10 kilometers apart, and they recruited 2 schools from each of those areas. And utilizing this formula, we calculated and got a total of 70 teachers in each group. So the training actually included interactive sessions on the common child and adolescent mental health problems, learning disabilities, and ADHD. So we actually utilized Dr. Tolulope Bella-Awusah's questionnaire for the knowledge and attitude area, and of course, we also adapted some questions for the learning disability and ADHD. Now, in terms of analysis, we use both descriptive and inferential statistics for the level of significance. We use analysis of variance and the t-test, and for us to be to test for the effectiveness of the training, we use ANCOVA. So, and of course, before the data collection started, this study obtained ethical approval from the State Universal Basic Education Board, SUBEB, in the Oyo State, and also the Ministry of Health Ethics Committee. So there were it was divided into several phases. The first phase, I collected data from the 2. Of course, since it was a quasi-experimental study, the 2 schools that were the control and 2 schools were the intervention group. That was Abadina Primary School and the you have the Salvation Army Primary School and the St. Paul's Primary School. Actually, these are the results. The demographics of the teachers, that there are the 140 teachers. We have 70 in the intervention group and 70 in the control group. So the mean age of these teachers, we are 49, standard deviation of 5.8, and the minimum age of those teachers were 32 years. And 89 of them we are female, and 57% of them had Nigerian certificates. And in terms of working experience, 42% of them had 20 to 29 years of experience. Next slide. Okay, now, since it was an intervention study, we wanted to compare the baseline knowledge of these teachers and the post-intervention scores. So this is the baseline comparison of the mean scores. In terms of, you can see the green there showing the intervention group and the yellow bar shows the control group. For basically within the baseline, the intervention group and the control group had the same knowledge in child and adolescent mental health and of course attitude. Of course, in this case, the intervention group had more negative attitude compared to the control at baseline. And of course, the knowledge on learning disability was almost the same. There was a big 2-point numerical difference. And the knowledge of ADHD at the baseline. Next slide. And this shows the mean scores for control group comparing the baseline and post-intervention. So after the intervention, the yellow bar here is the baseline, and the green, of course, shows the post-intervention. There was, yeah. Here, the knowledge, there is significant changes in the knowledge of learning disability and knowledge of ADHD. Of course, since developmental disorders are, we have several, we decided to look at learning disability and ADHD to do the teaching. And of course, the attitude, no change. And of course, also on the knowledge of child and adolescent mental health, there was also just a 0.1 numerical change. Next slide. A PRT test was done to actually show this one. And this mean scores for the intervention group, when we compare it with the post-intervention here. Now, of course, the baseline here. And next slide. Okay. This is a mean score for intervention group comparing the post-intervention score. Of course, there was a booster training, post-booster training. So the training, actually, we decided to give a booster training after 3 weeks. Then we decided to take others to collect data again, so that to find out whether there was a decay in knowledge or there was an increase in knowledge just after the booster. We decided to collect post-intervention score twice, the immediate, and a booster training was done. Then we took another data and decided to analyze this data. And this is the results for the post-intervention and the post-booster training. And of course, we also decided to compare this the intervention of both the booster and the immediate, comparing with the intervention group and the control group. And we found out that there was statistically significant difference on the knowledge of CAM. And of course, also there was also statistically significant difference on the knowledge of learning disability. And there was also statistically significant difference on the knowledge of ADHD. Here in this training, we found out that the training actually changed the teacher's knowledge on learning disability. They changed their knowledge on ADHD, but could not actually change their knowledge of attitude of the general child and adolescent mental health need. So we actually noted that such training has significantly improved teachers' understanding of specific conditions like ADHD and learning disability. But broader child and adolescent mental health awareness was actually harder to improve within the time. And of course, attitudes actually require longer time, social and cultural adaptation before there will be any change. So it demonstrates that teachers can be empowered as frontline mental health promoters in schools. Next slide. So the intervention effect, of course, an analysis of covariance was used to actually test whether the intervention was effective. So for learning disability, the positive treatment was confirmed by this analysis of covariance control for baseline scores, and it was statistically significant with a p-value of 0.01, and also for ADHD as well. So these are the intervention effects. So the analysis showed that the intervention produced medium size effect of 0.6 on the knowledge of learning disability and effect size of a larger size of 1.27 on knowledge mental health. So what's the impact of this study? It provides empirical evidence of the effects, low-cost teacher training model in a low-resource context. And educational impact is that it strengthens teachers' capacity to identify children with developmental and behavioral issues early. And of course, contributes to Africa-wide effort to integrate mental health into school system. So in conclusion, teachers' baseline knowledge of child mental health was low, and training led to a significant improvement in ADHD and learning disability. And of course, broader attitude changes require longer interventions, and the study actually bridges a crucial evidence gap in school mental health intervention in sub-Saharan Africa. So we recommend that extend a duration of training programs for sustained attitude change and scale up teacher mental health education across Nigeria and incorporate child and adolescent mental health module into national teacher training curricula and conduct a longitudinal study to track long-term effects of training. In conclusion, I wish to express my profound gratitude to Dr. Tolulope Theresa Bella-Awusah for her mentorship and guidance throughout this research. Without her contribution, this would not have been completed there. I could remember her words of courage when I actually, at some point, I wanted to give up, but she said, no, you must complete this. Her commitment to advancing school mental health research in Africa continues to inspire this work. I also extend my gratitude to Professor Cornelius Annie, whose expertise, patience, and guidance have been instrumental in this completion of the study. Happy birthday, Dr. Tolulope Bella-Awusah. You are indeed a gem in Africa. Thank you for your attention.
Thank you very, very much, Mr. Mohammed Kuruma James, for that excellent presentation. You only went, I think you went 3 minutes over time. I hope the others will stick to time so that we can finish good time. Thank you so much for that excellent presentation and for your words of acknowledgement and appreciation to your supervisors. We now move on. This session is titled The Ripple Effect of Mentorship. I now go on to the next presentation from set 3, CCAMH, Ngozi Chukwuka. Yes, Obey Jemba. On problematic internet use and depression among adolescents in schools. I'm supposed to have, I'm wondering where citation is supposed to come up. Sorry about that. Let me just check. I will stop sharing and try and sort that out quickly. Oh, okay, I see what happened. I just want to use this opportunity once again to welcome all our very distinguished faculty who have joined this meeting. I can see that Dr. Bella-Awusah's supervisor, one of our supervisors for her MSc CAM project, Professor Ademola Ajuwon, has joined this. Thank you so much. I saw Sir Professor Umigbodo. I saw him briefly. Maybe he's in and out. I just want to welcome everyone to this symposium and really appreciate you for joining despite your very busy schedule. Thank you so, so much. So we'll go on to the next, take the next. So as I said earlier, the title is The Ripple Effect of Mentorship, Alumni Presentations. So Dr. NG, as we call her, or Ngozi or NG, I think everybody calls her NG, is a 5th-year specialty registrar in child and adolescent psychiatry with the Norfolk and Suffolk NHS Foundation Trust in England. She's getting very, very good training so that she can come back to Nigeria and set up and build, become a professor in one of our leading universities, and also set up excellent services and join us here in this very needy area where we have most of the world's children are going to be placed. So she's just training in the UK to come back and give back and do excellent things here on ground. She got her MBBS from Madonna University in Nigeria and is in the 3rd set of MSc, the Child and Adolescent Mental Health in CCAMH. She had her residency training at the University College Hospital. It was a delight to have her work with us. And she helped pioneer school-based mental health services. I believe she must have been a resident when Dr. Awusah started going out into schools to do outreach programs. She's a member, she's passed her membership with the Royal College of Psychiatrists, and she's a fellow of the NHS East of England Virtual Learning Fellowship Program 2025-2026. I was extremely delighted. The work that Dr. Bella-Awusah supervised on, please can we mute ourselves? Please let everyone mute themselves, please. Thank you. The work that Dr. Tolulope Bella-Awusah supervised of her West African College thesis on problematic internet use and depression earned the 2025 Roger Makanjola Prize for the best dissertation in the Faculty of Psychiatry in the West African College of Physicians. I couldn't be prouder. And she continues to combine clinical excellence with teaching, mentorship, and research, inspiring young psychiatrists across Africa and beyond. And like I said, getting good training to return to build. So over to you, NG, to give your presentation. Thank you so much for being a part of this.
Thank you so much, Ma. Good morning, everybody. I'm going to be presenting my work. The title is Problematic Internet Use and Depression Among Secondary School Students in Ibadan, Nigeria. And this is in celebration of Dr. Tolulope Bella-Awusah, as we all know. My supervisors were Dr. Bella-Awusah and Dr. Victor Makanjola, and my supervisor of supervisors, Professor Olayinka Omimodun. So just to give a bit of background, during the COVID pandemic in 2020, it was evident to everyone that internet use was rising. Young people were spending far more time online than ever before. And Nigeria had well over 100 million internet users, many of them being adolescents. Yet little was known about the extent of PIU, or problematic internet use, among the vulnerable secondary school students who are largely adolescents. There's still no consensus regarding what constitutes PIU exactly. There is only a limited part of it known as gaming disorder that is included in our usual diagnostic guidelines like the ICD-10 or the DSM. Most conceptualizations, they converge on the definition that it is an excessive or poorly controlled use of the internet, resulting in distress or impairment in physical and psychosocial functioning. From the findings in the clinical context and in the general population, one of the commonest comorbidities of PIU is depression. And there are significant gaps that prompted this research. On one hand, it was the knowledge gap. Few studies that were focused on adolescent PIU were existent at the time, especially in Southwest Nigeria. And there was limited understanding of the psychosocial and cultural factors that contextualized PIU. And on the other hand, there's the gap in methodology. The World Health Organization has called for culturally grounded research that combines both quantitative and qualitative elements. And this study bridges these gaps. It provides the baseline data for this region. Next slide, please. It is the study adds evidence towards the eventual recognition and classification of PIU in global diagnostic guidelines such as the ICD and the DSM. And the findings will also guide development of culturally appropriate assessment tools and early intervention models for adolescents with PIU, both for Nigeria and in other low and middle income countries. Therefore, the aim was to determine the prevalence of PIU and its association with depression. And specifically, the objectives were to determine among the secondary school adolescents the prevalence of PIU, to identify the socio-demographic and behavioral correlates of PIU, and examine the association between PIU and depression, and to also explore the perception of PIU among these students. The study was a cross-sectional one, and it used the convergence parallel mixed methods approach, where both quantitative and qualitative data were collected at the same time, and the data was analyzed separately, but then both sets of the results were compared to strengthen the conclusions. 611 students who were aged 10 to 19, they participated in the study, and they were recruited from 20 randomly selected public and private schools within 2 selected local government areas in Ibadan. The quantitative aspect of the study, we utilized tools like the socio-demographic questionnaire by Professor Omibodun, the internet addiction test, the patient health questionnaire for adolescents was used to screen for depression, and the mini was used to confirm a diagnosis of depression in those who were aged above 18, and the mini kid for those who were less than 18. Then for the qualitative aspect, 8 focus group discussions were conducted among 77 students in total. The analysis was done with SPSS for the quantitative aspect, and for the qualitative, thematic analysis was done. For more advanced thematic analysis and interpretation of the qualitative findings, we use the Atlas TI. 113 of the 611 participants were confirmed to have depression, and others were also classified as non-depressed. But to start with, the PIU prevalence was estimated as 22.8%. For those senior students were noted to report higher PIU compared to the junior students. And other variables that were found to be significantly correlated with PIU were higher maternal education, poor school satisfaction, and difficult relationship with teachers, as well as those who perceived that they didn't like their families. Spending more than 10 hours online per week, lying and stealing to fund data for internet use were also correlated with increased PIU. Then among those who were depressed, 44% of them reported PIU, compared to 17% of those who were not depressed, indicating that students experiencing depression were more likely to exhibit PIU. Next slide, please. Binary logistic regression identified the key predictors of PIU among the adolescents. Depression was the strongest predictor, with adolescents who were depressed being over twice as likely to exhibit PIU compared to those without depression. Failing to fund internet use was also linked to higher PIU. Then, senior class was shown to increase the risk for PIU. In the model itself, the junior students had less odds of PIU compared to senior class, and the interpretation is that the senior class then increases the risk for PIU. However, spending less than 10 hours online and spending less than 500 on internet subscription were both associated with lower odds or decreased risk of PIU. So these findings, they cut across psychological, behavioral, and socio-economic domains. So what it just highlights is the multifactorial nature of PIU. In simple terms, it's shown in this visual model. It's just the interaction between PIU and depression, and it's directly proportional. Being depressed increases the chance of having PIU. Next slide. The themes on internet habits, perceptions, they were organized under 5 major discussion areas. Adolescents reported diverse positive role of the internet in learning, entertainment, and communication, but potentially harmful uses were also highlighted, including online betting and pornography. A number of factors were reported as the central drivers for PIU, including poor supervision and parental modeling of internet use or excessive phone use. Then social and emotional influences like boredom, loneliness, peer pressure, the desire for social validation. These were also listed, as well as PIU being a coping mechanism for unmet emotional needs. The participants also recognized the addictive design of certain apps, such as TikTok and Instagram, especially what they call the infinite scrolling, where content is loaded automatically as the user scrolls down the page, eliminating the need for them to click on next buttons or click through separate pages. And this sort of design keeps users engaged with continuous content, and they spend hours on their devices without knowing it. They also recognized consequences such as academic decline, moral deterioration, physical health problems like sleep issues. Depression was also listed, as well as suicidality. And they recognize the multi-level support that is essential in preventing PIU, including family engagement, being aware of how to use digital devices adaptively. They stress the importance of compassion over condemnation, that recovery is best facilitated in non-judgmental, empathetic environments. Next slide, please. So integrating the results from both strands of the study, it showed that some findings complemented each other and other findings differed. Both data strands highlighted depression as a central correlate of PIU. The quantitative study showed it as the strongest predictor of PIU, and then the qualitative study highlighted depression and mood problems as a coping mechanism for unmet needs. Although it revealed that household dynamics are important contributors to PIU. Regulating these findings, it showed previous slide with environmental stressors. Next slide. And the impact of this study cuts across board. It's among the first mixed methods PIU studies in Southwest Nigeria. The study provides a tool to advocate for depression screening for those with problematic internet use. and it can support the development and implementation of policy regarding school-based mental health and digital education. And most importantly, this study aligns with the World Health Organization's call for cross-cultural research. Next slide, please. I believe at this point, you will all agree that it's a beautiful study, yes. Our beautiful smiling faces in this picture does not look like what we went through in carrying out this work. Permit me to say this work showed us pepper. But I am grateful to Dr. Tolulope Bella-Awusah for her excellence in supervision and mentorship. Listening to all the congratulatory messages, one thing stood out, and that is what we know. Dr. Bella-Awusah will stand her ground. She stood her ground in ensuring the scientific rigor, ethics, and clarity for this work to produce this sort of high-class research. And it had no choice but to win the award for best dissertation, as was mentioned earlier. This work reflects the legacy that we celebrate today, Dr. Bella-Awusah's commitment to advancing school mental health within the field of child and adolescent psychiatry. Many, many thanks, Ma. And next slide. Thank you all for listening.
Thank you so much, NG, for that awesome mixed method presentation. Honestly, to hit the road with your publication and get it out into the scientific literature as well as a policy brief.
Thank you.
Yes, excellent work, Dr. Bella-Awusah. I was so proud. I'm a supervisor of supervisors.
Yes,
of our award-winning supervisors. Wonderful, congratulations! And
thank you,
I'm so grateful to listen to this morning. Thank you, and well done.
Thank you. Happy birthday.
Study well so that you can return soon to join us here as we build.
Yes, Ma, I hear you loud and clear.
You hear me loud and clear. Yes.
Nigeria
by 2050, we're going to have the third largest population in the world, and 60% of that population are children and adolescents. So we need all hands at deck to look after their mental health.
Yes.
Thank you so much. We move on to the next, and that is Eunice Umoren from Set 6. Yes, the ripple effect of mentorship clearly revealed. She'll be speaking on academic stress and mental health problems among in-school adolescents in Ibadan, also work supervised by Dr. Bella-Awusah. Mrs. Eunice Umoren is the administrator for the Students Counseling Unit in the College of Medicine, University of Ibadan. So she works closely in the College of Medicine in the counseling units, which this section is chaired and overseen by Dr. Bella-Awusah. And she also is the administrator for the Global chaired by Dr. Olabisi Oshikonlu and together with the co-chair, Professor Buki Adishino. Basically, the sponsor student program looks into providing funds for indigent students well over 200, and maybe she would tell us, 250 students in the college on full scholarships, tuition, feeding, accommodation, and we are so grateful to our sponsors. And I want to use this opportunity to ask, it doesn't cost you much if you want to support a student, an indigent student in the College of Medicine, with the scholarship will be named after you, or anyone you want to name. If you want to name it after your mother or somebody you love, that will happen. Reports will be given to you, and the students will, and when my class had our 40th anniversary in June this year, we had a special breakfast meeting where were able to meet their sponsors. I mean, who were able to meet the students they were sponsoring. It was a very emotional meeting, lots of tears, interesting stories about these brilliant students who are having difficulty staying in school. It was an amazing, life-changing encounter. And I must say that the Center for Child and Adolescent Mental Health, we have a student that we are supporting in school from the little from some of the funds we have. So there's a CCAM scholars. We have CCAM scholars. So thank you. And Eunice, well done. Eunice has a bachelor's degree in psychology from the University of Ibadan and a master's in child and adolescent mental health. And her work is academic stress and mental health problems, reflecting her passion for adolescent well-being. And she's facilitated several mental health workshops for various organizations and remains committed to promoting youth development and emotional wellness. And so Eunice, over to you, and we're going to be talking about two aspects. So thank you, and over to you.
Thank you very much, Ma, for the intro. Good morning, distinguished professors, CAM professionals, ladies and gentlemen. It's a privilege to present the study which was carried out in year 2018 and supervised by Dr. Bella-Awusah. I would like to say happy belated birthday to you, Ma. May the Lord bless your new age. The title of this study is Academic Stress and Mental Health Problem Among In-School Adolescents in Ibadan. Next slide, please. So these were my objectives. Next slide, please. So from the background, adolescence is a transition from childhood to adulthood involving physical, cognitive, psychological, emotional changes. It's considered to be a period between the ages of 10 to 19 years, according to WHO. Across the phases of adolescence, exposure to different stressors may result in mental health problems. Next slide, please. Some scholars have identified three categories of stressors that contribute to stress among students. These are the normative stressors, non-normative stressors, and day-to-day stressors. Academic stress has been classified under the day-to-day stressors and is described as the most important and frequently reported factors contributing to distress among students. However, few studies have explored academic stress and mental health problems among secondary school in Nigeria. Next slide, please. This study aimed to determine the prevalence and correlates of academic stress and mental health problems among senior secondary school adolescents. So for the methodology, it was a cross-sectional study carried out at Akienle local government area in Ibadan. Prior to its commencement, approvals were obtained from Ethics Review Committee and Oyo State Ministry of Education. 366 senior secondary school students were recruited in this study through a random selection, and they were between the ages of 11 to 19 years with a mean age of 15 years. These were the instruments used and the tools used to carry out the analysis. I must say that one of the instruments, which is the educational stress scale for adolescents, was adapted and revalidated to suit our setting. Next slide, please. So for the result, the gender distribution of participants shows that majority of respondents were female with a percentage of 54.1%, while 45.9% were male. Next slide, please. So the reported prevalence of academic stress showed 45.1% for academic than for the reported prevalence for mental health problems. For depression showed 41.8%, and for anxiety it showed 29%. So the socio-demographic correlates of academic stress shows that students in public schools were 2.3 times more likely to report academic stress compared to students in private school. And students in SS2 were 3.1 times more likely to report academic stress compared to students in SS1 and SS3. Female students were 1.6 times more likely to report academic stress compared to male students. Students in larger classes were 2.2 times more likely to report academic stress compared to students in smaller classes. So the social demographic correlates of depression shows that students from polygamous family were 1.8 times more likely to report depression compared to students from monogamous family. And students students in larger classes were more likely to, we are 1.9 times more likely to report depression compared to students in smaller classes. So the social demographic correlates of anxiety shows that students in public schools were 2.1 times more likely to report anxiety compared to students in private school. And as students in SS2 class, we are 2.4 times more likely to report anxiety compared to students in SS1 and SS3 classes. So the association between academic stress and mental health problem shows that adolescents with high academic stress are significantly more likely to report depression and anxiety. Please, next slide. In conclusion, there is a significant association between academic stress and mental health problems among in-school adolescents in Ibadan. And academic stress was higher among female students, students in public school, those in SS2, and students in larger classes. Next slide, please. This study recommended that the mental health education, this study recommended that school-based mental health education and stress management programs should be introduced in school. Counseling and psychological support for students should be provided. Policy that reduce excessive academic pressure and improve classroom environment should be encouraged. Also, there is need for further research, either qualitative or mixed methods, to explore the aspects of academic stress that are associated with mental health problems. Next slide, please. Okay, so I would like to talk about, briefly about the COMUHI counseling service. Just as Prof has said earlier, I've been privileged to work with the COMUHI counseling unit. The unit was established during the administration of the first female provost, Professor Olayinka Omoivodu, and it is headed by Dr. Bella-Awusah. It was set up to provide support and promote emotional well-being of students. Since its establishment, over 1,000 students have benefited from the service. Wide range of service. Dr. Bella introduced wide range of services, which include individual counseling, group counseling, crisis intervention, and workshops. For the workshop, she invites Dr. Bella-Awusah, invites people with expertise to speak on topics that are suggested by the student. And this is based on what the challenges they are experiencing at that time. She also established partnership with the clinical department within the University College Hospital. Student organizations like the UMSA, the NGOs like the ASIDOs, to create referral network and collaborative care approach. Next slide, please. So this shows the growth in individual counseling clients. In year 2021, the number of service users was low, with a percentage of 11.3. This was because at first, the students were skeptical about the service, but over time, their trust level increased and there was increase in growth. Next slide, please. So the unit has recorded a 90% satisfaction rate from the client survey, and this reflects positive impact of the service to the students. And it has also recorded positive quality feedback comments from the students. Please, next slide. My acknowledgement goes to Professor Olayinka Omibodo, the pioneer director of the Center for Child and Adolescent Mental Health, and to Dr. Tolulope Bella-Awusah, who was my supervisor and who is also my HOD, and the faculty members of the Center for Child and Adolescent Mental Health, University of Ibadan. Thank you.
Yeah, thank you so much. Thank you so much, Eunice. It's so amazing just what one person can do as we move along. I just want to also acknowledge all the faculty members. Once I acknowledge Professor Ike Ajayi, the director of IMRAT. I can see you. Thank you so much for taking time out to join this session. I also acknowledge Professor Bibilola Oladeji, for joining this session. We're very, very grateful for all you and congratulate you once again. Thank you, Lord. Thank you for being a great person, a trailblazer, and for all you've done and will yet do. There are higher heights ahead. Thank you. So we'll just go on. Just amazing what little things one can do to be able to make a difference. Thank you so much, Eunice, for balancing so many things. I know the Global Sponsor Student Program there's a lot of work. And you also have to, do the counseling and other things that you do in CCAM on research. But you're doing a great job. And we're so grateful for the great things that are happening in our institutions through just these little efforts. We now go on to the next presentation title, yes, the ripple effect of mentorship. Faye Shara Taiwo, set 7, will be talking about perception of pupils, teachers, and school administrators about mental health needs in primary schools in Ibadan, Nigeria. Faye Shara Taiwo is a program manager at the Center for Child and Adolescent Mental Health, and also has to balance that job, which is so demanding, with being a research associate on a couple of our grants. She's on the Shine grant, which is a grant on mental health and nutrition in schools. She's also on the Succeed grant. And I know many times it could be tough. And also, thank you so much, Faye, for working so hard to put this together. I must say you are amazing and we appreciate you. She holds a bachelor's degree in special education and a Master of Science degree in Child and Adolescent Mental Health, Set 7, from the University of Ibadan. Her study on perceptions of pupils, teachers, and school administrators highlights her focus on school-based mental health and her background in special education. She has extensive experience in both research and clinical practice, working with children, adolescents, and young adults facing mental health challenges. I'm also aware that she works with youth. She's in charge of the youth department in her local body of Christ. As a volunteer mental health therapist, she provides safe and supportive spaces for young people seeking emotional care. And her research interests include psychosocial disabilities, community counseling, and integrating research into policy to improve access to mental health care. We're very privileged to have Faye working with us as program manager in the Center for Child and Adolescent Mental Health. And I must add that she is a fashion designer. She's an entrepreneur, innovative entrepreneur, and makes beautiful, great outfits, which she wears herself. And also, I must say, I've been a recipient of her great generosity. Over to you, Faye.
Thank you so much, Prof. Ma. Good morning, everyone. Good morning, distinguished professors and all participants. I will be speaking on my topic, perceptions of pupils, teachers, and school administrators about mental health needs in primary schools in Ibadan, Nigeria. So I have a short outline which I will run through. Next slide, Ma. Next slide, Ma. So for the background of this study, according to the World Health Organization, mental health is being defined as a state of well-being in which the individual realizes his or her own ability, cope with normal stresses of life, and can work productively and fruitfully, and they are able to make good contributions to the development of their community. Research has proven that child and adolescent mental health disorder account for over 15% of the global burden of diseases, as half of all mental health disorder begins by the age of 14 years and 75% by the age of 24 years. Neuropsychiatric condition has been found to be the leading cause of disability among young people in all regions of the world. In sub-Saharan Africa, studies have proven that approximately 1 in 5 school children have a diagnosable mental health disorder, and close to 70% of these children do not receive the help they need. Also, those that receive help among these children could only receive this help within the school premises. This evidence suggests that school mental health services have the likelihood of reaching children in need because of the wide mental health treatment gaps in Nigeria. Reaching children in school would be a help to reach more children, as children spend a higher percentage of their times in school. If school mental health programs are well implemented, it has the potential to enhance pupils' social competencies, which could help to increase their assertiveness, help with their communication skills, help to boost their self-confidence, and also boost their academic performance in school. And in order to realize this, there is a need to understand the teacher's prior knowledge of mental health problems among school children. Next slide, ma. This study was previously carried out by Ibesieko et al., Ibesieko, Omidodu, and Bella-Awusah in year 2008, where they explored the perceptions of teachers and school administrators on child mental health needs and program in schools. And this study found that teachers and school administrators' disposition towards child mental health program in primary school was poor. However, this study was a follow-up of the Ibesieko study to understand what has changed over the years in the perceptions of teachers who are considered to be the primary administrators. Also, to understand the perceptions of pupils about their own mental health needs as the end users. Next slide, ma. This study aimed to explore the perceptions of teachers, pupils, and school administrators on the need for mental health programs in primary school. And the objective of this study is to explore the perceptions of these study participants about the common mental health problems among primary school children, and to understand the resources that are available within the school settings to tackle child mental health problems, and the resources that would be needed to address mental health issues in school, and also to know the barriers that the school administrators and teachers encounter in trying to give out mental health care within the school system. Methodology. This study was carried out in 3 local governments in Ibadan North, East, and Akinyele local governments. And for the study design, the study is a cross-sectional qualitative study that comprises of both key informant interviews and focus group discussion. Participants of this study were primary 5 pupils in basic. We are primary school pupils in basic 5 and 6. And the reason for this selection was because the pupils are deemed to have been developmentally matured enough to understand the simplified mental health concept that is entailed in the discussion guide. Other participants of the study are classroom teachers and school administrators. A total of 6 primary schools was selected for the study. The participants of this study were primary school teachers, primary school pupils, and administrators from the Universal Basic Primary Education Board, as well as head teachers. So results. This table shows the social-demographic information of participants, and on this table, it reveals are even across all the 3 local governments that was used for this study, and the same thing happened for the study type. The study happened in 3 pupils, separate for school administrators. Among the pupils focus group discussion, there were some themes that emerged when pupils they use stigmatizing words like madness to describe their understanding of mental illness among school children. An 8-year-old male from Urban Private School says, when a child is threatening another person without any reason, is his own understanding of mental illness. Next slide, ma'am. This same themes was generated across all the participants as teachers focus group discussions and administrators key informants uses the same words, mentally retarded, madness, insanities, sick upstairs to describe their understanding of mental health problems among children. However, some of the participants express their fear when they hear about mental illnesses in children. The second research objective is to understand. Next slide. The second research objective is to understand the current resources that the teachers and school administrators use to curb mental health problems within the school setting. And for the focus group discussion, it was mentioned that there is availability of self-counseling, one-on-one counseling with the child, use of corporal punishment, inviting the parent to speak with them, and also the provision of extra assistance to the child by the parent, by the teacher. Next slide. Among the focus group discussion, the teachers' focus group discussion and the key informant interview, the same thing was generated as they kept on to mention corporal punishment, they mentioned individual counseling. And also, one of the participants mentioned prayer as the current tool that was being used to address mental health problems in school. The 42-year-old female in one of the urban private schools said, if it has to do with spiritual aspects, then we pray a lot. Next slide, ma. So the research question 3 has to do with the materials that they feel will be needed to address mental health issues within the school system. The pupils focus group discussion mentioned the presence of a mental health personnel and also use of mental health materials within their school. A student said, this is to invite a doctor to come and talk about it. So this is to say that they have an expectation of listening to what mental health is from a mental health personnel. And the same thing was generated from the other participants of this study. They mentioned posting mental health personnel to schools, use of mental health materials. Next slide, ma. The research question 4 is to understand the barriers that could prevent children from receiving mental health treatment in school. And one of a constant theme to all the focus group discussion and the key informant participants is stigma, particularly for the pupils focus group discussion. They mentioned a 9-year-old male student from the urban private school said, some may be spreading the secret around. Next slide, ma'am. And the same thing was mentioned among the other participants of this study. However, another significant thing that emerged from this research question is that there is no inclusion of mental health in the school curriculum, as it was described by a female in one of the public secondary school who is a teacher. She said, the fact that government did not include mental health in the curriculum is a barrier. Discussion. For the perception of mental health problem in school, all the participants of this study used stigmatizing words like madness, not okay, brain injury, abnormal behavior to express their understanding of what mental illnesses in children are. And this is similar to the findings from the Ibasieko et al. 2008 study. Next slide, ma. Concerning the current approaches and resources that are available within the school setting to address mental health problems, respondents from this study highlighted the fact that there is a general lack of formal mental health intervention within the schools. However, they mentioned that they use some informal approaches to address mental health problems in school, and this include inviting the child to the teacher's desk, counseling the child one-on-one, providing extra assistance, and also the use of cane at some point. And this aligned with another study that was carried out in Nigeria. So teachers from this study and school administrators also felt they were aware of mental health problems in children, but they have ever lacked the required knowledge to address this mental health problem. So they requested for formal training in form of seminar, inclusion of mental health in teachers' training curriculum. And this is similar to the finding from Bella-Awusah 2001 study that reported limited teachers' knowledge of child mental health. When questions on barriers were asked, the participants of this study mentioned a variety of barriers to implementation of school-based mental health services. And one of the most referred to is stigma as one of the highest barrier among them. And this is also significant as a previous study by Boba et al. Said stigma has a greater relationship between mental health and school. In conclusion, this study contributed to filling the knowledge gap in understanding the current state of using a school as a medium to reach children who are in their need of mental health services, and also to understand the current perception. It helps to understand the current perceptions of stakeholders on the need for school-based mental health program, which shows an indicator that there are increased mental health awareness in school compared to the Ibasieko et al. Study. And also, in addition, the findings from this study included the need for more formal training, as the participants of the study clamored for more formal training. Recently, in the last 1 month, the Nigerian government moved to include mental health in the school curriculum, which is one of the outcomes of this study, inclusion of mental health in the school curriculum. Yes, next slide, ma'am. Acknowledgement. I want to especially acknowledge Dr. Tolulope Bella-Awusah for being an exceptional leader. Her support over the years has helped to shape me and help me to become better day by day. I appreciate you, ma'am. Thank you so much, and I wish you many happy returns of the year. Thank you.
Thank you so much, Feishara Taiwo, for that beautiful presentation. We are grateful. Awesome work. Congratulations, Dr. Bella-Awusah. I noticed we're running out of time, so we are going to move on very quickly. And I hope Chuka and Dr. Bumi will please maybe stick to the time or cut down a bit, so that, because we still have we're going to have a response from our celebrants on reflections through the years. We're going to have a brief discussion and have and then of course we have some pictures that we want to show of her work through the years in child and adolescent mental health. So please, let's move on. So we have Chuka Onoye, who's going to be speaking to us. He's an international person. He's speaking to us this morning from, I believe, Harare, unless he has moved location. He'll be telling us about mental health needs and services among university staff and students in Nigeria. Chuka is the media officer at the Center for Child and Adolescent Mental Health and the cross-site communication manager and co-lead for Succeed Africa Research Consortium. His study on mental health needs and services among university staff and students explores mental health within higher education settings. He has a BSc in microbiology from University of Abuja, a diploma and Masters in Child and Adolescent Mental Health from the University of Ibadan. He's currently doing an MPhil in Public Mental Health at the University of Cape Town. He has a scholarship. He leads strategic communication for this multi-country Succeed research consortia, and he advocates for co-production of solutions with individuals who have lived experience. He leads the African Hub of the Mental Health Innovation Network, promoting knowledge exchange across the continent. His career goal is to shape equitable, evidence-based mental health policies and systems across Africa. And I wanted to add through communication and the media. Currently, he's in Zimbabwe undergoing a workshop because the Succeed, our grants are going to be putting together a film of the 6-year journey of this grant. And Chuka is one of those at the forefront of this. I must also acknowledge his outstanding work in the Center for Child and Adolescent Mental Health, and also in the College of Medicine, University of Ibadan. For indeed, he did a lot of communication work when I was provost. A lot of the posters, the videos that you saw, which were done free of charge, were put together by Chuka and the team, the media team in CCAM. So Chuka, we're very grateful for all you've been doing. Over to you for your presentation, please. Thank you.
Yes, thank you, Prof, for the wonderful introduction. Good afternoon, elders, colleagues, friends, everyone who has joined this webinar. It's really an honor to be with you this afternoon to celebrate Dr. Awusah, a strong woman, a mentor for the great work she's doing in school mental health at the Center for Child and Adolescent Mental Health. Of course, obviously led by our distinguished Professor Olayinka Omibodun. I tell you, if you need great evidence-based research and materials for your school interventions, your projects, your advocacy, CCAM is the place and the center to partner with. So if you have just go right into the presentation titled, of course, working with Dr. Awusah, titled An Exploratory Study of Mental Health Needs and Services among Staff and Students of the University of Abuja, Nigeria. Because of time, if you have followed the previous presenters, you see that it's highly established that mental health is important for young people, especially because of the uniqueness of this stage of development and high prevalence of mental health issues are associated with this stage. So with this study, we went into the university to really explore mental health needs and services among students and staff. Why we went into the college is because we know that the traditional college age or university age is usually around 18 to 24. And this is a peak developmental window for the onset of many, many lifetime mental health conditions. Research shows that 75% of almost all lifetime mental illnesses begin by the age of 24, with median onset ages, especially for anxiety and mood disorders, falling directly within this period. So the university is really a great place where mental health interventions can come in. And we are not even talking about things like transition. Young people are living home by this time. They are facing a lot of increased academic pressure, new social dynamics, managing financial stress, developing their independence. And in Nigeria especially, we know that there are unique stressors. For example, overcrowded accommodation, excessive schoolwork. I know some people might be privileged to have gone to private universities where things are a bit better, but if you look at some of our typical government universities, there are lots and lots of issues. And literature has shown that the usage of mental health in campuses are very, very poor. Next slide, man. Yeah, so what we did was that we went into the school, the University of Abuja, and we wanted to explore what are the mental health needs, what are the services in these schools, especially among student staff and students. We needed to look at what are some of the perceptions of staff and students about mental health. And we wanted to know some of the stressors that are in the university and how they influence students and staff well-being. We needed to know we wanted to explore and know the students and staff perceptions of the mental health provisions in university, and to look at the available resources, wanted to know the challenges, and wanted to know some of the barriers to receiving mental health services. And most importantly, we want to really know and get recommendations of the kinds of services students and staff really wanted or desired in their campus. So what we did is a cross-sectional qualitative study at the University of Abuja permanent site. 42 undergraduate students were involved in this study between the ages of 15 to 24. And we were only able to interview 5 staff members. I think that period there was strike, so we were able to get hold of 5 staff members. We did 6 focus groups and key informant. Next slide. So what we found was really interesting. I mean, by the time I finished the study, you see that what we really need to develop mental health in schools is not really rocket science. I mean, students really associated everything about mental health with their social and environmental space. So students really affirm that mental health is important, especially for their academics, for learning and coping with stress. I'll just go a few quotes. Like this one said is, if you are psychologically sound, you know that you are focused because you know that you are here for your degree. So it will show mostly with your results, in your result. So some of the positive things students mention that were really good for their mental health is sports, social gatherings, spiritual activities. Next slide. Hello, next slide. So talking about stressors, so we're asking students and staff, what are some of the stressors what are some of the things that affect your mental health? And they mentioned that it's just major lack of basic amenities in school, lack of water, lack of good accommodation, lack of conducive classrooms. You know, the classrooms, some of our classrooms here are really, really overcrowded, and people have to trek long distances to get water. And sometimes water doesn't even come up in the hostels at all, and people have to just go to class without taking their bath. And some of the things they also mentioned is frequent cancellation of lectures. They said there were frequent cancellation of lectures and excessive financial demands for materials. And these were really, really affecting their mental health. And one quote here said, you don't buy your handouts. If you don't buy some of those things your lecturer wants, you are going to get a carryover. Students also say that staff interaction, the way that staff interact with students are really key in promoting their mental health. Students cited that some of the staff are really unapproachable. Some of them are hostile. Some of them are unfriendly, and it affects them. And one of the ways they coped in school were self-motivation and through prayers. Like you said, they say, the most important thing that keeps me going is just prayers and God, because this school is something else, seriously. So we also looked at the current services. So some of the students said that there were no mental health services in school at all. And some of them said they have not heard of any. And some said that even the new counseling unit, which is being built, is barely functional. Next slide. So some of the barriers we found is that students were feared being judged. So they said that, I mean, I can't, if there were services here, I fear being judged. I fear being labeled for seeking help. Imagine somebody seeing me coming out from a counseling unit. That person is going to say, so I have a mental health problem, and this is going to really, really affect me. And they also say that there is lack of trust. And their fear is that personal problems will be made public in classes, especially if the counselor or people in charge of counseling also appear in their classrooms. Next slide. So some students also mentioned that some of their teachers were unapproachable, that you can't even approach them, that they are unwelcoming, they look scary when they see them, they don't even know where to start talking from. Like this person said, the fear of talking to those officials, their faces alone, then the lecturers, their faces are not nice at all. Then a major barrier that some of the participants mentioned were tight academic schedules. So this person said, imagine having lectures from 8 to 5 p.m. and there is no time at all to seek help. So it's really a major, major barrier. People go to lectures from morning till evening. So which other time do you really want them to go and seek help? Next slide. So like I mentioned during the beginning, we also asked staff, just some of the few staff that we met, and decided almost the same thing with the students about basic amenities and infrastructure in the school. The staff said that their offices were poor, there are inadequate lecture halls, they have to schedule lectures round and round, especially looking for space for where they will give their lectures. And also, particularly, they mentioned that their unpaid allowances and their low salaries also affect them. Like this coach say, you cannot be talking about having a good mind where there are certain things that have not been provided, like area of paying salaries and allowances. Staff also confirmed that the counseling unit is quite new and not yet fully functional. Next slide.
You can keep going, Chuka. I think the internet in Zimbabwe is slow because
Okay. So these are some of the issues that we found, especially with the staff. Also, you can see from here that the salaries are really, really important. So what were the recommendations? So like I said from the beginning, these are basic things, structure that we need to put in place. We don't need to have so many psychiatrists. We don't need to have ambulances. We don't need to have a lot of hospital and all those kind of things to promote mental health. So what are their recommendations? Improve school infrastructure. We need a place where we can do our lectures. We need to make our environment good. That is basically what they are saying. They also say that the staff should be more approachable, and even though they said act as, like, in quotes, second parents, and the students also say that they need to take responsibility of maintaining their environment. The participants also they say that we need a place that is well equipped for mental health care. And they suggested that we need to hire professionals from outside the university to be. So they were saying that we don't need to have like counselors based in school or taxing with teaching. We need to bring people outside. And they said that this will really help them to build trust and build confidentiality. They also say that very, very importantly, that services needs to be integrated, especially with services in place. So the mental health place should not be just a one alone place. It should be integrated. For example, you need a student's loan, like Eunice is doing in the College of Medicine. You need a student loan. You should be able to assess it in the counseling unit. You need other forms of care. The counseling unit should be a place that you can also link and access other services. It should not be standalone. They also offer to have online support, which they say will help them to be flexible with their academics and help them provide privacy and all that. And also importantly, they say a mental health course should be introduced as a curriculum to all students in this school. Yeah, next slide. So which is very, very important. I think most of our schools, I don't know if we have any form of mental health course, except those maybe in doing maybe psychology and all that. So that marks the end of my presentation. Before I go, I want to really, I'm deeply grateful for Dr. Awusah for her immense contribution to the success of this project. She has really been supportive to me, not just this project, but also in my life entirely. I remember when I was doing the transcription, he said, Chuka, the first one you submitted is not good. You are skipping the words. You need to transcribe verbatim, word for word. I was just reading by ear, word for word. And I know that she also trained under Professor Lainka, especially in qualitative study. And I also want to thank Professor Lainka. Professor Lainka was actually was the one that motivated me to go on and do my master's after I came for my PhD. So I also want to thank the center and thank everyone who has really joined. Thank you and God bless.
Thank you so much, Chuka Onoye, for that great presentation. And thank you for the acknowledgements. We appreciate you for all you do. So moving on, last but not the least, we have Oluwabumi Fola Bolumole. Don't worry, I will get it when they set 9. She'll be speaking on the effects of web-based CBT and psychoeducation intervention on depression among clinical students of the College of Medicine, University of Ibadan. I know that we hope to put this on our YouTube channel so that people can go back and watch this, because I think this is very important for students, for policymakers, for everyone. The findings from Chuka's study are really wonderful. And like I said, they're not rocket science. So let's listen to Dr. Bumi, consultant child and adolescent psychiatrist, a dedicated advocate for youth mental health, working to improve care accessibility in resource settings, MBBS Ibadan, Master of Science, Child and Adolescent Mental Health from CCAM. CCAM is the place to be. Fellow of the West African College of Physicians in the Faculty of Psychiatry, and recipient of the Luke Egerton Prize for the best candidate in the college membership examinations in psychiatry. She's passionate about developing and evaluating innovative service delivery models, and with a specialized interest in leveraging digital platforms, and I would say AI, to overcome artificial intelligence systemic barriers like stigma and resource constraints. Her goal is to establish a robust research career dedicated to designing, evaluating, and implementing scalable mental health interventions that can improve access and outcomes for young people across Africa. I believe God will help you to fulfill your dream. Over to you, Bumi.
Thank you very much, Ma. Good afternoon, sirs and Ma. It is a great privilege to be here and to be one of the speakers in this symposium in honor of Dr. Bella-Awusah. I find myself privileged. Thank you. So I'll be talking on my work titled The Effect of a Web-Based CBT, that's Cognitive Behavioral Therapy and Psychoeducation Intervention on Depression among clinical students of the College of Medicine, University of Ibadan. And Dr. Bella-Awusah supervised me along with Professor Mibodo. I will use this outline. So by way of introduction, mental health problems are a public health concern, and that's because of their contribution to the global burden of diseases. A lot of the earlier speakers have talked a lot about this, so I'll just go very quickly. But we know that there's a double burden of disease because as much as we are struggling with communicable diseases, the prevalence of non-communicable diseases, including mental disorders, is also increasing. Now, the period of young people, of youth, is a period that it's a window period that is crucial for us to intervene, because we know that this is where lifelong mental health may be shaped. As has been said, 3 in 4 of mental disorders happen within that period. In addition to that, we know that university students, as Chuka has mentioned, face a lot of challenges, and this also contributes to stressors that can increase their risk of mental disorders. Studies have also shown that clinical students are at even a higher risk than their other counterparts. So we've also seen that there's a lot of challenges for these subsets, that's university students, clinical students, to access mental health care. And some of the challenges are the limited access to health care, the high costs, which many of them cannot afford. There's a lack of awareness. Some people are not even aware that these are conditions that can be treated. And then there's the issue of shame and stigma that also surrounds mental health and mental disorders. Internet-based interventions prove to be an opportunity, can provide an opportunity to circumvent some of these challenges because they can be easily accessible. In the long run, they can be cost-effective, and then many people in different studies have perceived it as less stigmatizing. Studies have also shown that young people may prefer digital health interventions, and then if these interventions have things like videos, ability to personalize it, not too much text, and that they're able to connect with people, then it has been shown that they prefer this kind of interventions. So this study, what we aim to do was to measure the effectiveness of a web-based intervention that we administered to university students who had clinical depression. And the specific objectives were 5. We wanted to look at the prevalence of depression among these people, then to see the changes in depression literacy and depression symptoms, the changes in their level of satisfaction with life or subjective well-being, and then their satisfaction with the psychological intervention that we offered over a website. So this study was a pre and post intervention. It was a single arm, and there were 2 phases to it. The first phase, we identified students that had significant depressive symptoms and those that had clinical depression. And then after that, we administered the web-based psychological intervention for those that had significant depressive symptoms. The participants were undergraduate students of the Faculty of Clinical Sciences, College of Medicine in University of Ibadan from 3 programs. Those that were running programs in bachelor programs in nursing, physiotherapy, and then Bachelor of Medicine and Bachelor of Surgery. So for those that were eligible for the intervention, they had to have mild or moderate depressive symptoms. That's a total Beck Depression Inventory score of between 11 to 30. That correlates to mild and moderate depressive symptoms. And they had to own an internet-enabled device. Those that scored higher than 30, that correlated to severe depression, were referred to the Child and Adolescent Psychiatric Clinic. Then we excluded those that had severe depression, like I said, and then those that reported that they already had a diagnosed mental disorder. These were the instruments we used. We used the social demographic questionnaire. We tested the knowledge of depression before the intervention and after. We also measured the depressive symptoms using the BDI. Those that had significant depressive symptoms were then, we administered the mini International Neuropsychiatric Interview. That's a diagnostic questionnaire to establish a diagnosis of depression. And then we also gave the satisfaction with life scale. This is a measure of a subjective well-being. Then after the intervention, we also added the client satisfaction with this. So for the procedure of the study, at baseline, we had a multi-stage sampling. We used proportionate allocation to get numbers from different programs and levels so that we could have adequate representation. And then from those different programs and levels, we had simple random sampling. So we recruited a total of 358 participants. After getting the informed consent, we collected the baseline data. We excluded 5 because there was incomplete data. And then 4 participants who whose scores related with severe depression, referred them to the Child and Adolescent Mental Health Clinic. After screening, 298 did not have significant depressive symptoms, but the remaining 51 were eligible for the intervention because they had mild to moderate depressive symptoms. Out of the 51, 1/3 of them declined intervention on basis of very busy schedule. Some had tests and exams coming up, so we excluded them. And those 34 who agreed to participate were all had the intervention. We took the data, baseline data before the intervention, and then immediately after the intervention at week 6. So this intervention, it was a combination of psychoeducation and basic CBT skills. We developed the intervention following a structured model from literature in 5 steps. The first step, we identified the target problem being depression among the target population. And then we developed the program theory, basically that psychoeducation and CBT can improve literacy and symptoms of depression. Then we designed the intervention modules. I did this with my supervisors who are very experienced with CBT. I looked at different established manuals of CBT to do this. Then refining the intervention, there was an advisory group that consisted of Mrs. Eunice, who was one of the speakers, who is the coordinator of the counseling services for the College of Medicine, and then 4 service users who had depression and had received care for depression. After this refining period, then we tested it with experts. The experts were psychiatrists, psychologists, and then 2 people with lived experience of depression. We took in their inputs and then modified it and then eventually disseminated it. Next slide, ma'am. So the intervention was uploaded to a secure website that was dedicated for the study, and it was password protected. Users had to create an account and then have passwords, and then they accessed the intervention with different modules. So each week they had one module to access. So there were videos, text, and interactive activities. And usually the module will start with a video followed by practical examples, interactive exercises, and then at the end of that module, there'll be an assignment to submit before the start of the next session. They had to complete one module before moving to the next. And then we were given weekly text messages to remind them. So the 5 modules, this is a breakdown of what the 5 modules were about. The first was an introductory session, psychoeducation on depression, and then self-care strategies. Then we looked at recognizing and challenging automatic negative thoughts. We also looked at behavioral activation, problem solving, and then at the 5th week, we summarized everything we did. We addressed specific concerns we just set in. And then at the 6th week, we sent a link for the post-intervention questionnaire. So a total of 353 participants took part in this study with a mean age of 22.6 years, standard deviation of 2.4. Most of the participants, that's about 2/3, were female, and most of them were Yoruba. Almost all were single and Christian, and the majority of them had fathers and mothers that had attained tertiary education. This just shows the gender distribution at baseline. Like I said, 2/3 were female, and then this shows across the different programs the gender distribution. Next slide, ma'am. This shows the characteristics of respondents at baseline also, compared males and females. So we see that females had higher depression scores at baseline than males, and this was statistically significant. For the knowledge of depression, although females had slightly higher scores, it wasn't significant. Same with satisfaction with life, it wasn't also significant. So for the prevalence of depression, using the BDI, like I said, the BDI is a screening tool, so that just tests for significant depressive symptoms. It was 15.6%, that's 55 people out of the 353 had significant depressive symptoms, while for the diagnosis of clinical depression, 9.9%, that's 35 of the respondents had clinical depression. The females had consistently higher clinical depression, rates of clinical depression and depressive symptoms. Next slide, ma'am. Okay, so this shows the characteristics of the participants at the intervention. Most of them were females, most of them were from the MBBS class, followed by the nursing and then physiotherapy. So on the clinical characteristics, following the intervention, we see that there was an increase, there was a decrease, reduction in the mean depression scores from 17.35 to 4.62, and that was statistically significant. Same with the depression literacy. The depression literacy improved significantly after the intervention. Although subjective well-being also improved after the intervention, this was not statistically significant. For the participant satisfaction with this intervention, the satisfaction was generally, it was rated with qualitative and quantitative measures, and it was rated generally high. So the range of satisfaction scores was out of 40 was 22 to 36, which with a mean score of 29.62, which corresponds with high levels of satisfaction. About majority of them rated it as good, about 1/3 rated it as excellent, and only about 6% said it was just fair. Nobody rated it poor. And then only one participant was not willing to come back to the program if needed, but all of them were willing to recommend the intervention to a friend. These are some of the, based on the answers to the open-ended questions, which were thematically analyzed, we came up with some things. So for what they liked best about the program, they found the program helpful and relatable. They liked the fact that it was free of charge, it was the anonymity, and then it was easy to access. Those were some of the things, and then there's some quotes here that show these things. Next slide now. Then this is supposed to be what they did not like about the program. And some of the things that emerged were the fact that there were some technical difficulties. So a number of them had some difficulties and had to reach out to address those difficulties. Some pages were not loading at some points, although those were promptly addressed, but they still experienced those difficulties. Some people complained that it was time-consuming and cumbersome and took into their study time. Some people also complained about the the assignments, that they were excessive. The models that they liked best, the problem solving and cognitive therapy skills, they liked best, although a number of them said they liked all the modules. Then for their recommendation, next slide, ma. So suggestions to improve, they wanted us to fix the technical issues, to give less assignments, to make the content more relatable, to have more examples that they could relate with. And some people wanted the program, one person wanted it to last longer than the 5 weeks that it did. Next slide, ma. So the prevalence, like I said, the prevalence of depressive symptoms was 15.6 and clinical depression 9.9. This was significantly lower than many global studies that I found. And some of the explanations for this may be that those that had depression may have declined to participate in this study in the first place. And then the fact that the College of Medicine had some support services. There's a counseling unit, the student welfare program, and this may have already helped to improve the students' mental well-being. Next slide, one. The intervention, there was a significant reduction of depression scores after the intervention with a large effect size. And this is consistent with literature that has shown large effect size for psychological interventions that on depression literacy is also consistent with literature that when you have the psychological intervention that has some psychoeducation, it improves the literacy, depression literacy. One of the studies was one domiciled in CCAMH, and Dr. Bella-Awusah and Professor Migbodun were also part of. And studies have also shown that when you improve depression literacy, it improves the person's well-being eventually, because they're able to recognize symptoms of a relapse and can handle it better. On subjective well-being, there was no significant statistically significant improvement, although there was some improvement. This was similar to a Kenyan study, although some studies from America, Europe, and Australia showed improvements after a CBT intervention, but this was not the case in this study and the Kenyan study. For the acceptability of the study, it was there was a high acceptability, and the study offered some advantages like anonymity. It was accessible and convenient. And this one was free of charge, the intervention. Some of the drawbacks, like I pointed earlier, were the technical issues. There were some concerns of confidentiality, although the website was secure and it was password protected. And then there were concerns about if the potential crisis problems, how do we come in? For the limitations of this study, it would have been better if the study was a randomized control study. It would have been able to say that this was the effect of the study and not just time, that the effect of time and all. The fact that there was no long-term follow-up, we couldn't measure the sustained effects of the intervention, and then the technical issues and the small participant number may also limit the generalizability. For future directions, I hope to work on this to do maybe to follow up a bit longitudinal studies that can follow up the effects of this a bit longer, to have some more studies in other places and eventually be able to scale it up. So this study shows that a brief CBT-based intervention delivered via a website is effective and acceptable in this population. Thank you very much.
Thank you very much, Bumi, for that beautiful presentation. Our time is fast spent, so we'll just go very quickly now, and I'll just take a couple of comments before we go to the next aspect of our agenda, please. Any comments, please? Any comments? And then comments, questions from either, if there are lots of comments in the chat box already. Any hands up? Any members of the faculty who would like to comment? Any of our CCAMH alumni? We want to give you opportunity if you want to comment about your work in school health or any part, just 1 minute. Please, we welcome comments. There are a lot of comments in the chat box, which we would harvest. Any comments? Okay. Those on the other side of who are not in the panelists, you can put up your hand and you can be unmuted. Or, okay, there are two hands up. Are they hands? Okay. Femi Okunlola and Lady Gwen Media. Would you make very, very brief comments, please? Your hands are up. Are they able to speak? Admin, are you unmuting them? Femi Okunlola, their hand is up, and Lady Gwen Media. Very brief comments, please. Yes, Femi Okunlola, can you? Yes.
Yes, I'm not one of the alumni. I'm not in the faculty. I just happened to stumble up on this link, and I joined, and I've enjoyed it. I'm a school owner in Nigeria. I have a school, a secondary school, primary school, and listening to this has been very, very enlightening and eye-opening. So I just want to say that you're doing a wonderful job there, and I just wish all the stakeholders, the government, our commissioners for education, all those in charge of our curriculum will really listen to this. And I love the idea of you not just putting it on YouTube, but let's call their specific attention, maybe packages, send it to them, let them listen. And I believe it can really arrest the issue of mental health from the foundation. You can even go lower to nursery, preschool, and address this thing as early as possible before we become a crazy country dominated by crazy adults. So, am I using wrong term? Maybe I told you I'm not.
Thank you, sir.
God bless you, Ma. So thanks for the privilege. I've been blessed a lot.
Oh, thank you so much. That is so, I'm so happy for that feedback. Could you please drop your contacts and in the chat box so we harvest it? If we have programs, short-term programs or workshops, we would invite you. Thank you so much for that feedback. Yes.
Thank you, Ma.
Thank you. We're grateful. Lady Gwen.
Thank you very much, Prof. And thank you to all the faculty, the presenters. I guess I should say I'm a fresh graduate from CCAMH. And I never actually took or knew, even as a broadcast journalist with almost 30 years experience in broadcast journalism, I really didn't think there was a structured school mental health, not until CCAMH, and not until through the help of Dr. Bella-Awusah, we went for a course visit to one of the schools in Ibadan, and I saw how important school mental health is and how structured it can be. And it opened my eyes to another aspect, of child and adolescent mental health. Sincerely speaking, coming to CCAMH has been like mind-blowing, and the contribution of the acting HOD or director, has been quite immense. I remember one of the times in the class, I said to myself, I wasn't going to say anything today. I'm going to allow other people to talk. And then she said, isn't Lady Gwen in this class? No, she has to say something. And by the time I spoke, she said, it's always encouraging for me. And I just pray our life would be like a shining star. And I pray that, her cloud will forever be blue, will never be dull or gray. In Jesus' name. Thank you very much, Professor, also for what you're doing. You inspire also. I was reading, I was hearing all the citation from Dr. Bella-Awusah, and I remember at your inaugural lecture, and I was saying to myself, especially for some of us that we've transitioned from another industry to psychiatry or child adolescent mental health. Thank you so, so much. Thank you. I'm so overwhelmed. Thank you, ma'am.
Thank you, Lady Gwen, for that feedback. We're really grateful. Thank you. We have another hand up as our laureate, very senior colleague, Professor Falusi, Professor Adeyinka Falusi. Thank you so much, Ma. We're grateful to have you. Thank you for giving us some feedback. Thank you.
Thank you very much. I'm so privileged to have attended. You know, when you were talking at the beginning, it's like, oh, this is for psychiatrists and these of us in the periphery of this kind of thing, we have really gained a lot. Today has been a beautiful day for me because the time spent so far shows that all of us as relates to health, whether you are selling tomatoes in the market or you are driving the car in the street, we all benefit by having knowledge. It is knowledge that is basic here. You don't have to be a professor to know things about what's around you. You know, when you're talking about the fact that non-communicable diseases or the communicable ones, the non-communicable we are talking about now is affecting, in fact, it's the same result we're getting the communicable diseases. If you look at those in sickle cell area, you know, this is a very traumatic problem for them. They are unable to come out to speak until you have a workshop or you have a meeting and you call them and then they start crying, they start telling you all these things. And it's all because of this stigmatization. And that is lack of education. And this is what we are battling with in many of the areas where a child should have spoken up and be confident. You know, in the US and other places, a child will tell you, this is what's wrong with me. I have been to this hospital like 100 times. He will say it. I was on bed for so long. Here we hide all these things because we don't want the next person to know we have a problem. And because of that, the thing magnifies and the frustration is greater and so on. So what I would suggest is that look at the work of the doctor, the media person. Look at the way he analyzed what is happening in the university. I had children there. A medical student goes to fetch water at 6 a.m. on her head to bath to go to chemistry department. The water falls off, she falls in the pit, and she's still getting ready for school in the morning. These are the problems we have on ground. And unless these structural things are put in place, that we can have children be in conditions that may not be like their homes, but can at least mimic something that is good for their health status, we're going to continue to have issues. You know, they don't have money to eat. You have 001, and then they left home where there is food because of the search for knowledge. And then they get there, and what they see is not what they expect. So I'm suggesting that it's a very big task. Mental health cuts across every issue, even in the home. In the home, knowledge to know what you should do to the other person to give a good mental health. And so I'm saying that the curriculum, somebody mentioned it, that's where I was going. The curriculum, right from the basics, should teach it in graphic forms to primary school, teach it to secondary school level. By the time you come out of secondary school, even if you don't want to be a big academic, you can tailor this to where you work, help yourself to have a mental balance, know where you should use your money to seek for health facilities, know when you should listen to radio on certain issues that are being discussed even in Yoruba language, so that you can help yourself to have a balanced mental health when you should go to hospitals and fulfill your engagement with your doctors before the things get worse. And then the universities should ensure that this curriculum, it is important. The curriculum in GES level, where somebody goes to medicine, another one goes to Arabic studies, but all of us should be taught at the different levels of education so that we can even help our own selves before we can help those in our families and in the community. Thank you very much.
Thank you so much, Ma. We're so grateful to have you and for that feedback. We're going to try and package this in different ways to send out because it's so important. Information is knowledge, you know, and information should bring change. Thank you so much. I just read a few comments. there's so comments. We have okay. Yes, Dr. Mrs. Femi Okunlola, thank you so much for your comment. We have that. Then Olanike Akimboyi, thank you for this comprehensive. Please let us be more available in our schools. Across the country, or there's another comment here from Mota. It says, oh, I'm super happy to be here. My name is Rubiat Barry from Sierra Leone, West Africa, final year student pursuing my MSc in pediatric nursing at the College of Medicine and Allied Health Science, currently writing research. What I've learned from the presenters, I'm so grateful. You're very welcome, all the way from Sierra Leone. Then there's a comment here that says from Dr. Adaora Onoga, well done, that was interesting, I'm glad to be here. Then Dr. Grace Agocha, good presentation, Bumi. Then Dr. Buki Okafo, you people should come home. Well done research, Dr. Fola Bolumole. CBT, when delivered with fidelity, works, and it's the homework that makes it work. Congrats, Dr. Bella-Awusah, again on your impact on your mentees and school health in Nigeria. So many lives are impacted because of you. And Buki, again, mental health is health, and integrated services will help reduce stigma and improve access. And lots of comments we have here. We're very grateful, and we will just go very briefly. And before the response from our celebrants, we'll just show some very interesting pictures. It's amazing how time flies. So we're going to be showing a picture journey of various activities of our celebrants. Well, the key is school mental health, and there's no health without mental health. But I was told these are loads and loads of pictures that we have 50 so moments that matter, a journey of grace, of dedication, impact, and grace. 50 golden photos of action in child and adolescent mental health. Sorry, let me just take this off.
You know they care. Life math is complicated. Affinity Plus made his life easier. Learn more at Affinity Plus.
So this is Tolulope Bella, 2006, making a presentation at the IACAPAP Congress in Melbourne, Australia. This is Tolulope again, with Myron Belfa, Muidin Bakari, rest in peace, Patricia Ibiziako, and our Professor Bibilola Oladeji and myself. This is a picture of remand home from through the years. This is at the remand home. You can recognize so many of us here. That's Yinka too. Through the years, just depicting the faithfulness of God. This is 2010, the day I was elected president of IACAPAP. That's Tolu, together with other colleagues. This is the SOS village. That's Tolu at the back in our outreaches to Ijebu. It's a picture of service. This is the first set of the pioneer set of the Center for Child and Adolescent Mental Health, 2014. All of them are doing great things. This is the dinner we had for the pioneer set. Very sadly, one of the pioneer sets, Pose, has passed into eternity, but we celebrate her legacy. This is them, Dr. Tolulope with CCAMH set 3 students. That's Matron Ikwe. We have here Matron Tolu, Kende, Lawal, and Professor Abdulmalik in my office. This was a meeting, a visit by the then Vice Chancellor to CCAMH. Tolu was doing a presentation. That's Tolu delivering a speech of school mental health at Paul Hendrickse. That's Tolu and myself. I must have been appreciating and commending her. Well, this picture is very historical. We have the first Nigerian child and adolescent psychiatrist. Rest in peace, Emeritus Professor Michael Olatawura. There he is I'm standing beside him, and Tolu is on the other side. So he was my mentor. Drew me into child and adolescent psychiatry. Well, I don't know what we were laughing about. Maybe Tolu will remember. It was at a CCAMH event. Another picture with Nigeria's first child and adolescent psychiatrist. That's Tolu there. This is with set 3 CCAMH students. I can see Ronita Luke in this. I can see NG, who gave a talk, and several others. This is the set 3 graduation, the ladies in the class. Wow, NG, you look different now. This is set 5. We have in front CCAMH admin. We have Diola and Kunle at both ends. Jibril, Yetunde, Matron, Tolu. Through the years, this is with set 5. This is when we newly refurbished the child and adolescent psychiatric clinic. I'm grateful to the MacArthur Foundation for providing, I use their funds. It's within the UCH, but we got funds from one of my research grants. This is Tolu in Nairobi in 2007 at the Ayakapap study group. We're standing together there. We have awesome people. A couple of them have gone into eternity. This is the Ayakapap study group, 2009 in Abuja. Tolu always, she doesn't mind being at the back. She never fights for a front seat or a front row. Now, this is historical. The leaders of the association, African Association for Child and Adolescent Mental Health. We took this photo at the conference in Durban, South Africa in 2014. Well, this is Tolu with myself and her childhood friend, Dr. Patricia Ebeziako, who is also a child and adolescent psychiatrist in Boston Children's Hospital. And they attended the same nursery school and they were classmates in medical school. Another picture, this picture, I stand with 4 of my mentees. They were all in the pioneer sets. They were all in the pioneer sets of CCAMH. Dr. Rotimi Adejumo, Tolu, Yetunde, and Jibril. This is Tolu and myself and Professor Shehu Sali during a conference. This is during the conference. This is also a great picture of Tolu with Jibril and Dr. Naufel Kado, a child psychiatrist from Tunisia, at the CCAMH conference in 2016. We'll be having another conference next year. We'll let you know about it 10 years after. Another picture, this is Professor Cornelius Ani, who together with Professor Ajumo supervised Tolu's master's work in front of the College of Medicine. This is in Prague in 2018. We have Tolu with Dr. Oluwayemi Ogun. She's the pioneer president of Association of Child and Adolescent Psychiatrists. Dr. Yewande Oshodi, also a former ACABAN president, currently Secretary General of IACAPA. This is set 6. We can all see, sorry, Rita, I wanted to show Rita Tamambang. Rita is, thank you so much, Rita, for all you've done for this, towards the success of this. And that's Tolu at the Day of the African Child, again, speaking on school health. That's her again. That's her doing at a Transform research meeting. Another meet. This is Tolu at Succeed meeting. Another photo. This is Tolu with us. And that's her as acting director addressing CCAMH set 12 students during the orientation program. That's her again. You see, I'm not even in this photo. So things are going on without me. And for me, that's success. And of course, Tolu, for I know the plans I have for you, declares the Lord. Plans to prosper you and not to harm you. Plans to give you hope and a future. We celebrate you 50 years. Your dedication has lit a path that others will follow long after the moment fades. Happy 50th birthday, Dr. Tolulope Theresa Bella-Awusah. There are higher heights ahead. So that's our pictures through the years. And I'm going to ask, it was Bumi, was your suggestion, but I'm going to ask the Dr. Rotimi Adejumo, can you just, everybody, her response. Let's put on your videos. I hope our photographers are there. Dr. Adejumo, are you able to speak? Can you propose a toast? Very short. Propose a toast. Sean, you want to putting up your hand? What's the problem? Hello, Sean. Why are you putting up your hand?
No. Just acknowledging that we're ready to take the pictures. Sorry.
Okay, so Rotimi, can you propose the toast, please? Everybody put on a big smile.
Thank you very much, everyone. We've heard a lot about Dr. Bella-Awusah today, and so we'll just be proposing a toast, thanking God for many years of service and dedication and excellence. Would you please join me this morning in congratulating Dr. Bella-Awusah on her 50th anniversary. Here's to Dr. Tolulope Bella-Awusah. Hip, hip, hip.
Hooray!
Hip, hip, hip.
Hooray!
Dr. Awusah, here's wishing you many wonderful years ahead, many more years of impact and many more years of great fulfillment. We've all benefited from your leadership and mentorship, and we wish you many, many, many more wonderful years and accomplishments ahead. Thank you very much.
Thank you so much. Thank you. Yes, thank you. So you can put off your videos. Go ahead and we'll give Tolu time to reflect and speak. You can take the next 1 hour if you like. I'm here with you. Any of your family members on this call?
Yes.
Before I
Yes.
continue.
My husband
Cool.
is here. My
speak.
siblings
Let
are
him
here.
speak. Okay, let them speak before you. Please, can they, if they put up their hand, we'll bring them into the speaker section. Simeon, can you bring them? Let them speak before you, please. Please, if they put up their hands, let her siblings speak, please, and she'll speak last. Edai. Okay, let's give Edai 1 minute. That's from Edai is calling in from Gambia. Edai, can you speak quickly before her family?
Hello.
Yes.
Can you all hear me?
We can. Introduce yourself briefly and speak.
Is it good morning from the Gambia here? I send my greetings to all of you and my appreciation to Dr. Bella-Awusah, my mentor, my supervisor, my friend and sister. Congratulations and a happy belated birthday. And to you, Dr. Omik Bodong, I greet you all. I am happy to be part of this program. I've been following it since the beginning. And all I can say is thank you. All that you have done in me has shown a great impact in the Gambia here. And we are doing all we can to be able to help children in schools. I look forward to seeing you all again and working with you. Thank you so much, Dr. Bella. I'm happy to be part of this program.
Thank you so much, Ada, for joining, and thank you for coming. Ada is what set was Ada?
Set 6.
Oh, set 6. You are Rita's classmate. Okay.
Yes, Rita and Eunice and the others.
Yes, wonderful. Thank you for coming. Yeah.
Thank you, ma. Thank you.
Bless. So we'll take comments from Tolulope Bella. You can put on your video if you want. Tolulope Bella. And then Dr. Awusah, please. Thank you.
Okay, good afternoon, everyone. This is Olutola speaking. The celebrant's younger brother. I've thoroughly enjoyed the symposium. It was very well put together, and I would also like to say, big congratulations to the entire team. I think the work that you're doing is incredible, and Nigeria is very, very fortunate to have you doing this work. So Tolu, congratulations again. Very, very proud of your work and your accomplishments, and I'm happy to say that I'm also very proud to be your brother. Thank you very much. It's been great being here. Thank you.
Thank you so much. Tolu, which of your brothers is Olutola? I know you have
the lawyer. Tola, the lawyer, yeah.
The lawyer in Lagos.
Yes.
Okay. Is his wife with him, the pastor? Is your wife there? Let her give us.
No, she's not, unfortunately.
Okay. I thought she would give us some hot early morning. Okay, then. Dr. Ikechukwu Awusah, over to you.
I need to say thank you. I'm overwhelmed. Whenever the way you do things, it's short that you have taught me a lot. I remember the first time when me and Tolu were getting married, she told me she's going to show me that she needs to take me to you. I've always regarded you as her mother, second mother. I was sweating. And you interviewed me to find out whether I'm qualified to marry your daughter. If I start talking, I don't know what to say. what you do, your impact in our life is amazing. You know, it's only God that God will bless you. Look, listening today, I've never heard of this kind of situation before where it's happening. And I think Nigeria need people like you. You are a door opener. You know, it's like I'm just praising you, but you are really amazing. You are really amazing. And your daughter, the way I hope I've tried though, you're looking after your daughter. I want to say thank you and thank my yeah, she has been a wonderful wife. You know, I remember when I was doing my PhD. If not for her, it would not have been possible. She stood by me, and you know, I don't know what to say except say thank you and thank God that brought all of you together and brought me into your midst. And you people have been a blessing to me, my wife. You know, and also I must commend Professor Mibodu, Mayor. You know, he was the one I saw when he was talking, and I said, geez, I like this man. That I want to be like him. And because of him, I said I must do PhD. You know, yes, so they told me that doctors don't look nice, professors are not clean, all those kind of. When I saw he was well dressed, was handsome, and he was cool. So I said I want to be like this man. So directly or indirectly, he was my mentor. So when I think about you all, I always think about good things, and God has used you in great ways, and I know you will continue to use it in great ways. I want to say thank you very much. In what you have done for me, my wife, our family. It's not something I can say here, there's so much. And for this which you did today, not only is it a lesson for me, and I'm hoping that I can be able to do such a thing in my own university, you know, and I want to say, may God bless you, guide and protect you always. And to my wife, I want to say, honey, happy birthday. And I'm praying that we celebrate another one when we are 70, or another one when we are 90, and another one when we are 120.
Amen.
Thank you very much, man. Have a blessed. And everybody that is here, thank you so much for your contributions and what you have said. I'm really impressed, and I'm proud of my wife, and I'm proud of this association. I want to say God bless everybody here. In Jesus' precious name.
Amen. Amen. Dr. My daddy Chisom, thank you so much. Thank you for being a blessing. I know all you do. I know. So I really, really thank you for helping her be at the center stage of the things she's doing. Thank you. God bless you too. God will answer your prayers because you deal kindly with your wife. God bless you. Thank you so much. So on that note, we'll just go on and Tolu, what response do you have?
Okay, so good morning, good afternoon, everyone. My heart is full. I just want to say a big thank you to everyone, especially to my academic mom, my mentor, my teacher, our founding director, Professor Layinka Omibodu. Just as my husband was saying, you know, you are a person who celebrates, who lifts others. You lift others, you raise others, you build others. And I've watched you, you know, celebrate people over the years, mostly teachers and mentors. And today, you are celebrating your mentees. Mama, you are so blessed. You've been such a blessing to me, to my family, and I really want to thank you. Today's celebration is not just my celebration. It's a celebration of your legacy. I'm one of the fruits of your legacy, you know, so I'm so proud of you, Ma, and I'm so grateful to you. And really, Ma, I don't know how you do it. You know, I'm sure many people here don't know that Prof just welcomed her second grandchild a few weeks ago. So she's doing grandmother duties. She's doing Omugo. And in the middle of this Omugo, she's organizing celebration for her mentee. Thank you, Ma. God will honor you. God will continue to celebrate you. You are a blessing, a huge blessing to all of us. Thank you so much, Ma. I also want to thank all my teachers who have graced this occasion. teachers from the undergraduate level, my postgraduate level, my supervisors. Thank you. Because of time is fast spent. I cannot call every, but I really want to say a big thank you. I want to thank all the speakers for today. Even though I supervise this work, listening to all of you made me so proud. I'm just like, wow, this is fantastic work. Such a beautiful work. And as Prof was challenging you at the beginning, we need to get this out through publications, through policy briefs, through podcasts, whatever way. We need to get out this amazing work that we are doing on the continent. I also want to thank my family. I want to thank my dad. I just saw his comments a few minutes ago. I thought he actually didn't make at almost 80, he's still in active service, still runs a clinic from about 8 to 4 every day. And when I first told him that we had this symposium, I was like, this is at the peak of my clinic, but he's made effort to be here. Thank you, Daddy. Thank you for your Goodly heritage. I'm really, really grateful. I also thank my mom, my late mom, who I'm sure is smiling down from heaven. Thank you, Mommy, for a good heritage. I thank my siblings. One of them just spoke. I think about 3 of them are here today. They're the best siblings a girl could have. Thank you so much. I'm really, really grateful for all your support over the years. I thank my wonderful husband, who spoke a few minutes ago. Without his support, I would not be able to do half of what I do. So thank you, sir. I am so grateful to you. I also want to thank my friends. Amazingly, I have 3 close friends who are child psychiatrists in the US while I work here in Nigeria. And one of them, Dr. Paula Okafo, she's made so many comments, she's actually board certified as a pediatrician and recently as a child psychiatrist. And she's come all the way. It's actually about 2 a.m. or 3 a.m. her time right now. And she's been fully in the symposium. Okay, I really want to thank you. Thanks so much. You're the best friend a girl could have. Thank you. I want to thank everyone who's been here, our partners in the school, in school mental health. I think I saw Mrs. Mushade Bola of Bill College, members of her team, partnered together for years, working to move school mental health forward. And I just want to say thank you for being here. And finally, I want to thank Almighty God for the grace to see this day. 50 doesn't feel very different from 20 or 30, but I know that it's a huge grace for me to have attained this age, and I'm forever grateful. And just a few reflections, on my journey in school mental health, in child and adolescent psychiatry and school mental health. I started almost 2 decades ago with entry data in Prof's house. So I was entering her school data. She's done one of the largest school surveys in Nigeria. And I was entering this data, and that was where really I started, before we now went out into the fields, did a lot of needs assessments and different things. And I'm so grateful to you, once again, for adopting me as your academic daughter, for counting me worthy to walk on this visionary journey with you. And it's been an exciting ride, so fulfilling, so rewarding. And I look forward to so many more years of a lot of work, of a lot of progress in what we do. So once again, I want to thank everybody. I cannot mention all the names, but I see all my colleagues from the College of Medicine, from the department, I see staff, I see students. Thank you so much for being here today. God bless you all. Thank you.
Thank you. I know the day's fast spent, although I say the morning or the night, but once again, I was going to ask somebody else to move the vote of thanks, but I think I'll just, I would first of all want to acknowledge your dad and your mom for raising great children and for raising you. One of the things I said was your love for social justice. And, you know, many people wouldn't like to work in the places we went into work. Going into remand home, SOS village, school for children with this. I mean, we were out there and you never once, you were very passionate about it. In fact, sometimes I used to go to those places and I would cry. And my heart was, there's so much wickedness and injustice around. But to have somebody to partner with you on those journeys, and really I had nothing to offer, but you came on that journey with me. And it made a lot of difference. You've been a friend, you've been a buru. Occasionally we have our fights. I do the talking, you do you're a good listener. I talk plenty, and I'm sure the people who plan this with me are annoyed. Everybody is saying how humble you are and how nice. I wonder what they But I just want to say I want to thank your parents. I want to thank your parents and also your siblings, and thank your husband too and your children for giving you to the world of CAMH, child and adolescent mental health. And thank them for joining this meeting. I also want to thank all those who have joined, particularly the CCAMH faculty. At different times, I saw Professor Migbodun, Professor Junwon, Professor Ajayi, and Professor Oladeji is here. All the CCAMH faculty that have decided, interestingly, like Dr. Adejumo is in they all CCAMH faculty. They were CCAMH students, now they're faculty, including yourself. And like I said, I had to make you a sacrificial lamb. When we got the CCAMH money to start CCAMH, I said to myself, Tolu, you can't be doing research on this. You can't be investigator. Go and do the masters. And it was rough. And I mentioned it. You were faculty. You were also teaching on another master's program. You were doing clinical work. At some point, you got pregnant. And I remember when you were doing the study, that's CBT study, you were heavily pregnant. I remember very, very vividly going to the fields to do cognitive behavioral therapy. It was rough. It was tough. But God had mercy. God had mercy. And I know you've gone through the waters, but you are not drowned. You've gone through the fires of life. You have not been burnt. And there are higher heights and deeper seas ahead. So just thanking you again and again and again. I'll keep coming back. I also want to thank all the members of psychiatry who have joined this meeting, the department. Thank you so much. I appreciate you. From the head of Department of Psychiatry. Psychiatry is my base, number one base. I'm not going anywhere. I'm there in psychiatry. I was employed as a lecturer one in psychiatry. And I'll remain there in the department till I retire. But it's also good. We've started the CCAMH, Center for Child and Adolescent Mental Health, which is a multidisciplinary, multi-professional center. And I'm so happy that we are able to do so many great things across the continent. I'm one person who I always support good initiatives. And just look at CCAMH. Look at CCAMH. Eunice is now the GSAB's administrator, council. Look at what we're doing. Fei's program manager. Diola, currently finishing up her PhD in Warwick, is doing so many things in research. Tommy Singh, all these people doing great things. CCAMH, Bumi, NG, we're so proud of you. And one of the things I found is because Matron is a multidisciplinary program. So we had in your set, Matron Onile Moore was in your class. You were there. The atmosphere on the ward is so beautiful because we are all a team. Whether you're a psychiatrist or a nurse, we all work together as one because we have a common purpose, common vision, even though our tasks are different. So it has really, really helped us. I want to thank all the participants who have joined from across. I'm so grateful for those who saw the flyer and just joined. Dr. Kunlola, I'm really, really grateful. I noticed a couple of people. I don't want Dr. Yewande Oshodi joined. I saw her make a comment. She's joining from Australia. And Dr. Jite, several people have joined. I can't mention you. Dr. Olubukola Omobowale, who is the psychiatrist that never was. She's thank you so much, Buki. We appreciate you. Dr. Ayotunde Omotosho, the president of the Association for Child and Adolescent Psychiatry and Allied Professions, in Nigeria, joined this in this meeting. Ayo, thank you so much for all you do and all you're doing. I can see Mrs. Oladele, Dr. Akweyemi Ajibola joining from Abuja, Precious Maki from Malawi. Wow, we have so many wonderful people on this who have joined this from across the continent. We're very, very, very grateful. Bukola Arowojolu, is it the same Arowojolu that was on the research on the Transform? Maybe you should write a note. It's a long time I heard from you. Thank you for joining. Bingpe Oshinu B. Tosin. There's so many people who Dr. Ade Folari, who is in the Department of Health Promotion and Education. Different people, amazing people have joined this meeting. We are deeply, deeply grateful. Oluwaseun Adeleke, thank you so much for all you. I mean, I can't mention you all, but we appreciate everyone who has taken time out to join and make comments. We are deeply, deeply grateful. And those your 3 friends who are child psychiatrists, they should become CCAMH adjunct.
We'll work on it, ma. Yes, ma.
Yes, you don't have to be in Nigeria. You can teach virtually. So thank you so much. Dr. Kwabena Kosi-Mensah also joined. Oh, great to see him. He works with you as Secretary General, and he's just been elected the president of the Psychiatry Association for Ghana. CCAM is the place to be. CCAM is taking over the world. He also needs to do his work in ACAM. Please remind him. But Dr. Kosi-Mensah, thank you so much for joining. I also see that Dr. Yeyinka Kosi-Mensah is also on this call. Thank you so much, Kosi-Mensah, for joining. There's, is it Mojisola Ajayi? Several people have really graced this. Okay, Professor Migbodun says, Tolu, congrats on your Golden Jubilee. The best is yet to come. I must read what Dr. Moshidat Bello Mojid. Thank you so much. One of our leading child psychiatrists from Dr. Aisha Tube Abubakar from the North has also joined this meeting. Thank you, everyone. We will do a little release and we'll make sure this is on YouTube. I also want to thank the planning committee. I put a committee together and we're writing grants. We're doing many things at the same time. So and then we're going to the field. So I really pushed people. I want to thank Fei. I want to thank Rita, Chuka. I got annoyed with Chuka at some point because he was not responding. I got annoyed with them many, many times. So you know me, but I thank you to the planning committee. Simeon, who is on the wealth grant, who arranged, she did the editing of put the slides. I also did editing. I was working for many hours overnight to edit your slides. I really, really thank all those who planned. Tommy Singh put together the pictures. We worked with me to put those pictures together. Great job. Sheung has been doing the releases. Chuka did the Timothy Ibe did the video with Chuka and Michael. It's just been one big family doing things together, just because we love you and we appreciate you. Everyone has come together to celebrate you and celebrate CCAMH and celebrate school mental health, because we know it's something that we really need to celebrate. So thank you so much. I'm really, 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 really grateful. And on this note, I just want to ask that, God will be with us and bless us, that we would rejoice and celebrate with one another over and over and over again. And we can now, if you're free to leave the meeting, but I'm going to stay on a bit and chat with some of my friends I've not seen for a long time. So God bless you all, and the meeting is ended. Thank you. Thank you. Thank you.
Thank you, Prof.
Thank you. You can put on, Rita, I didn't see your face, so you didn't say anything. We can take informal comments now that the meeting is over.
I'm looking, I had headaches, so I'm still at, yeah, so I was not looking very nice.
Never mind. You always look nice. You always look nice.
Prof, man.
Yes.
This is Lady Goyne.
Yes.
Congratulations on your new grandbaby.
Oh, yes.
I had the privilege of that's awesome.
Yes, and it's now, what's the time here? I actually woke up, it was 3 a.m. because I'm 6.
Oh,
I'll catch up with my sleep. Thank you so much.
It is
Yes.
well. My dear Dr. Bella-Awusah is so highly favored. And I know we have her tomorrow at the
MH Gap.
MH Gap. So I'm going to be teasing her a lot.
Wow.
I'm going to be disturbing her training a lot tomorrow. But then, Prof, I look forward to sitting at your feet to also bask in your wealth of knowledge, by God's grace, one of these times.
You're already doing that indirectly.
Yes.
I mentioned I used to sit at ward rounds and I'll be thinking of something about the patient we just assessed. And I'll go around, ask everybody. And the only person that will get what I was thinking about, I couldn't understand, was Dr. Bella-Awusah. So I said, my goodness. And that's what Deola mentioned. So thank you so much.
Thank you very much, ma'am. God bless you all, ma'am.
Feyi, Beleo.
Yes, ma. Thank you, Prof. Ma.
Okay, well done, all of you. You did really well. Yes, Ayotunde.
Wonderful. Thank you.
Yes, it was really nice. You did very. I didn't thank our speakers. I wrote it here.
They did so well.
They did so well.
So
They
well.
did so well. Please, I hope those who are still on, please, Bumi, all of you did excellent. Feyi, NG, I was, many of these things I'd either forgotten, I was learning about for the first time. Really fantastic work. Really, really great work. CCAMH is the place to be. So, good night, everyone, or good morning. Have a great day. Rita, I don't have headache. Please, I beg you. We have work.
Yes, ma'am.
Okay then, everyone.